के शुक्रवार के व्याख्यान में मैं आप सभी का हार्दिक स्वागत करती हूँ। सभी पार्टिसिपेंट्स का भी बहुत बहुत धन्यवाद और आपका स्वागत है। आज के स्पीकर का विशेष धन्यवाद कि आप हमारे निवेदन पर आप यहाँ आए और आप आज का लेक्चर्स के डिलीवर करने के लिए आपने तुरंत अपनी अनुमति ऐसे हामी भरी, तो ये भी बहुत बड़ी बात है। और मैं डॉक्टर हर्षा जी मौलिक सिद्धांत विभाग से उनका भी हार्दिक धन्यवाद करती हूँ कि जिन्होंने डॉक्टर तेजा जी से हमारा परिचय करवाया। तो बहुत बहुत धन्यवाद डॉक्टर हर्षा जी। और मैं सभी पार्टिसिपेंट्स को कहना चाहूंगी कि इससे पूर्व भी 471 लेक्चर डॉक्टर तेजा जी ने आयुर्वेदा इन कॉस्मेटोलॉजी में लिया है। वो भी एक्स्ट्रा ऑर्डिनरी था कि कॉस्मेटोलॉजी के लिए आयुर्वेद में कितना विशेष रूप से सोचा गया है और हम उसमें कितनी अच्छी बढ़िया प्रैक्टिस करके भारतवर्ष के लोगों को लाभान्वित कर सकते हैं। तो आप उसको भी कर सकते हैं, देख सकते हैं। और आज का लेक्चर भी एक्स्ट्रा ऑर्डिनरी है और इसका सबसे बड़ा सामने जो एक परिचायक है कि अभी मैं और आप मिलकर 25 पार्टिसिपेंट्स ने ज्वाइन कर लिया है। तो ये भी हमारे लिए बहुत अच्छी बात है कि आज का टॉपिक बड़ा रिलेवेंट है। बहुत सारे लोग पेशेंट्स रोगी अभी हमें इस समय हेयर फॉल को लेके मिलते हैं। तो हेयर फॉल का आयुर्वेद में बहुत अच्छा सॉल्यूशन भी है। तो आपने बहुत ही रिलेवेंट टॉपिक सिलेक्ट किया है, हेयर फॉल इन आयुर्वेदा। आज के स्पीकर का परिचय मैं सभी के सामने रखना चाहूंगी। आपका नाम है डॉक्टर तेजा ओलेटी। आप कंसल्टेंट है वर्किंग इन द हर्बेजेल लाइव श्री मथा आरोग्य धामम। आपने बीएमएस, पीजीडीसीए, पीजीडीएन, नाड़ी विद और अग्नि वर्म में आपकी स्पेशलाइजेशन है। और अभी वर्तमान समय में आप आयुर्वेदा, कॉस्मेटोलॉजी एंड न्यूट्रिशन में बहुत अच्छी आप अपनी सेवाएं दे रहे हैं। तो ऐसे विद्वान स्पीकर का, और यंग एज से ही विद्वान है ना, भी पहुंचते पहुंचते तो हो ही जाता है, मगर इनिशियल समय से ही, शुरुआत से ही एक अच्छी प्रतिभा को लेकर चलना जो आयुर्वेद के उत्थान के लिए बहुत ज्यादा आवश्यक है। तो ऐसे विद्वान स्पीकर का मैं स्वागत करती हूँ। ओवर टू यू डॉक्टर तेजा।
Yes, am I audible, Dr. Shetalji?
हाँ जी, you are audible डॉक्टर जी।
Yes. First of all, I would like to thank you for giving me the opportunity to present. Plus, the introduction was very nice. It was more flattering. Thank you so much for that. And I would like to tell to the party so that what Dr. Shetalji is doing, a simple task नहीं है। हर Friday continuously without break जो series चल रहा है, that is not a simple task to get a lecturers who will give their time, that too in the evenings. So first of all, I would like to congratulate her for doing this continuously since some 400-500 lectures. That's a very great job जी, like really बहुत बढ़िया काम है
जी। डॉक्टर साहब, आप जैसे लोग योगदान देते हैं इसीलिए चल रहा है। धन्यवाद जी।
नहीं okay ma'am. So without wasting further time, we'll just dive into the topic. So today's topic is hairfall in Ayurveda. Now, what is the major importance of this hairfall? Like हम जब यूजी कर रहे हैं या when we are in internship, generally even many of our friends or our family members, we get two concerns mainly. One is joint pains that you will get in when you're studying second year itself. First, that many of our relatives, they keep suffering from joint pains. And when you come to fourth year or internship, when your friends actually recognize you as a doctor, they start asking you, "Arey, mera hair fall ho raha hai, kya karna hai? My hair is, there's a lot of hair fall, dandruff, etc. Kya karna hai?" So this is one of the raising concerns in the present society, and in which you can treat very easily, frankly, just with the medications you can give a lot of results, which I will be showing in the slides. And if you do Virechana, or if you do Nasya, or if you do Vidya Karma, you can give excellent results. you can do wonders far better than a dermatologist or a person who does PRP or any cosmetic surgeon, etc., provided you diagnose the disease properly and give the chikitsa properly. So before starting lecture, I would like to take the blessings of Dhanvantri, Lord Dhanvantri, the Lord of Ayurveda. Om Namo Dhanvantri Namo. So now, when you what to target in hair fall, like as such हमको बहुत कम ड्रग्स जिसको डायरेक्ट रेफरेंस है ये केशा है, वो बहुत कम मिलता है. जैसे कि दीपनापाचना यू गेट एन नंबर ऑफ ड्रग्स. हाँ, वातहरा पित्तहरा यू गेट एन नंबर ऑफ ड्रग्स, और शोतहरा पांडहरा यू गेट एन नंबर ऑफ ड्रग्स. बट केशा, under the name केशा, you get very less number of drugs. So participants can just put message in the chat box. I will say it. So if a person comes to you with hair fall, so हम क्या टारगेट करते हैं? जैसे कि फॉर एग्जांपल रक्त पित्त में यू कैन टारगेट द रक्त, और कोष्ठा में यू टारगेट द you give drugs which have affinity towards the koshta. So in the case of hair fall, what do you target? Please put in the messages. I would like to see what's your point of view. Asti, good. Yes. No, don't overthink. Just put it. Correct or not, everyone has a different perspective. So let's see. Even I can learn a new point from your perspective. Agni and lifestyle, good. Very important. Rasadatu Asti, very good. Dr. Ujjwala. Tough Pitta, very good. Asti and Pitta Dosha, Dr. Suprita, very good. Yes. Amla Pitta, good. Yes. Pitrak, very good. Dr. Nidhi. So, okay, yes. Thank you, Hetalma. Santarpaniya Janyavyadi, very good, Dr. Ujjwala Sheila. I am not sure whether I spelled it correct or not. So, yes, this is one of the Santarpaniya Janyavyadi in present days. That's a very good answer. So, many of you are correct. 90% you are correct. So, which aushadhis do you give generally? Please drop in message. Which aushadhis do you give? Do you give proprietary or water? So, क्या देते हैं generally? Abhi, I think most of your pages, yes, Bungra Sava, very good. Pitta Shamak, very good. Okay, I think only two messages. Okay, let's continue. Brahmi Brangraj Sela, good. I guess it's Sukesh. Gandak Rasayana, good. भूनिम्बादि रसपाचक रक्तपाचक रस्य मध्यपाचक रसायन चूर्ण, ये मैं साउथ इंडिया से हूँ, तो we don't use this rasapachak, but the ideology is good. Navaya Savala, good. Rasadatu Chikitsa, yes, ma'am. Many according to Avasta, yes, good. Amalaki, yes, good. All of you are correct. Yes, Saptamrutaloha, good. Astidatu Poshak Chuna, very good. Trimigna, yes, in few cases of alopecia areata, good. Asti Poshaka, good. Shirodhara, yes. Panchakarma, Shirodhara works very well, yes. Nasya, good. Nasya, yes. Amalaki, Bungira, Yesti, Nirgundi, Dravya, yes. Acha, how does Nirgundi act, Dr. Ujjwala? Like in what case do you give it? Brungraj Chundanasya, yes. Narsimha Rasayana, yes. Dr. Anita, yes. Every one of you is answering. I think there's no point in this lecture. Everyone is giving very good answers. Yes, Krimigna and Kesha, yes. So I'll just yes, Dr. Ambika Shirodhara and yes. So I'm here to present my understanding, my point of view. Maybe your point of view might be different. See, water. It's like you know, अभी एक उंगली को we are seeing. So from my perspective, it looks different. From your perspective, it looks different, and none of us are wrong. So I'm just presenting my perspective, which had worked for me. And if you have different perspective, it's working very well and good. So let's dive into the main topic. So coming to the intro of Asia. Thank you, Dr. Hetan. So it is a Pitru Jabhava mentioned by Charaka Sharira 3/7, and it's a Parthiva based, like Zyada majorities, it's of Parthiva. And it's Achetana. That is, it does not have any Chetana life. That's why you don't get a pain when you cut the hair. So there's one interesting point here. Even though Ayurveda tells it as Pitraja Bhava, a recent allopathy research or whatever you tell, it tells that hair, the genetics of hair is dependent upon n number of factors. These mostly these n number of factors are dependent through genetics, are dependent on both mother and father. But one main gene comes through X chromosome, that is from the mother. So allopathy has a different take on it, but you never know. Again, they'll come back and say, no, we were wrong and it comes from Y chromosome. So one point मैं क्या बोलता हूँ, that you should follow what Ayurveda tells. You should understand it through your own lecture and never question Ayurveda. So that's what I did. That's what I'm getting results. So Nidana. So why is Nidana important? So it's like without understanding the cause, हम जो treat कर रहे हैं, it will be like you're carrying water in a broken pot. So what happens? Even though if you take a pot full of water, it will be leaking from down. So you won't get कितना हम ले रहे हैं उतना नहीं आएंगे हमारे पास. Yes. So this Nidana is very important because until and unless you stop the Nidana completely, हमको जितना हम results expect कर रहे हैं वो नहीं आएगा. So for example, अभी Dr. Hetal ji focuses a lot on Rajasvalacharya. So that's why probably if she treats any Sriroga case, she will get a better result than me because मैं इतना Rajasvalacharya में I don't have a grip on that. So hence she is getting results. That's the important. So that's the important of Nidana. Even while you are dealing with any unnamed disease, Charaka in Trishoti Adhyaya tells there are three factors which is to be kept in mind. One is Vikara Prakriti, one is Adhisthana, right? And third one is Hetu or Samuttana. So Charaka himself tells that Nidana is very important. So I think we are far below Charaka to exclude Nidana. But अभी Hairfall में क्या निदान आएंगे? Generally अभी हम जो पढ़ते हैं वो they tell nutritional deficiencies. Thank you, Dr. Shitalji. Nutritional deficiencies, hormone imbalance, etc. We'll see through classical references ताकि हम कितना समझ सकेंगे. So this is how I follow. I'll explain you why each Nidana is important. One is Agnimandya Nidana. This you can get from Vimanasthana of Charaka or Grahani Chikitsa or simple Nidana Atyamupana, Vishamashanat, Swapna Viparyat, Vega Vidaranat. So this set of Agnimandya Nidanas we should keep in mind. Coming to the second one is Rasava Shota Nidana. Why? I'll explain further. Raktava Shota Nidana. This also you'll understand while we are dealing with Sushrita's Sampratti. Astiva Shota Nidana, as many of you told. Santarpaniya Janya, one which is explained in Langana, Brahmanaya Adhyaya, Viruddha Pakramaniya Adhyaya. This also why you will get in the next slide. Shiroroga Nidana. Shara Lavana Atiyoga Nidana. This is very common as people consume lot of packed foods or a lot of one with preservatives. As you know, the preservatives are generally, or salty foods such as moong dal, these are all generally Shara and Lavana in nature. So excessive consumption of this, Charaka directly given under Trini Dravyani Nahati Upayujyati, it leads to hair fall. Agnimandya Nidana. Again, you all know the famous quote, Roga Sarve Api Mandagno. Under the context of Udara Chikitsa, even though it's mentioned, if Agnimandya is impaired, if Agni is impaired Rasa Utpatti happens. So what happens when Rasa Utpatti is impaired? Uttar dhatus are not followed. You will get Rasa Pradoshaja Vikaras. And this Rasa Pradoshaja Vikaras, usme kya hai? Akala Vali, Palita, etc. That is mentioned as few of your answers. Yes. And Rasava Shota Nidana, such as Guru Ahara, etc., which you can get it under Vimanasana. So, again, it's a direct reference of Rasa Pradoshaja. Now, Raktava Shota Nidana. This is one of the hidden main part of Samprakti. Yes, Chintana, Mate Chintana, stress, now main reason and kidney. Yes, correct, Dr. Ujjwal. So what happened? Yes, Raktava Shota Nidana, main part of Samprakti. And Astiva Shota Nidana, such as Rukshahara. Rukshahara is the main Aharaja Nidana which you can get in Astiva Shota Nidana. This can happen, Astikshaya can happen or Asti Pradoshaja can happen, due to which again hairfall will happen. And again, we'll discuss it further. Now, Santarpaniya, what happens in Santarpaniya if due to present day sedentary lifestyle, etc. For example, Guru Ahara, junk food, Devaswapna, no Abhyayama. Due to all this, Veda Vriddhi happens. Now, this Veda Vriddhi happens through Samarasa. And Sushruta, while under the Dosha Dhatu Vriddhikshaya chapter, he tells Amarasa Utpatti happens, due to which Ama Medas increases and it causes Veda Vriddhi. Now, this Veda Vriddhi is very important in multiple levels. One is when Medas Vriddhi happens, like, as you know, Medas is in between of the Sapta Dhatus. Now, it's like a Dhatu which maintains equilibrium. And its Prakriti Karma is Snehana. And excessive Snehana, again, you will see what happens in the further slides. So, due to Meda Vriddhi, loss of Uttara Dhatu happens. So, Asti won't get nourished. Then again, Ojas also will be affected. And if you observe carefully, or if you analyze carefully, Vedas Mala is Sveda. And what is the proper function of Sveda? In Patantara it tells Kesha Vidrutihi. Then in commentary, if you read it tells Romanam Avalambanam. So Vedas has directly effect on Asti and on the Romakupa directly itself through Sveda. And Shiroganadana, of course, it's Kesha is mainly Shiro Ruhanam, it is role, it's Adhikara is in Shira, like Adhishtana is in Shira. And Sharalavana Yoga, as explained. Now, अभी आपको जो भी hairfall case आ रहा है, you just read this, read the Shota Nidanas and present day-to-day life में क्या कर रहे हैं, वो हमको mind में रखना है. For example, Astiva Shota Nidana, many of people does not consume milk, does not consume ghee or any type of snehana, they won't do. Raktava Shota Nidana, what is it? Drava Ushna Vidagdha Ahara. Now, in the form of Drava Ushna, what you will get? Instant coffee, tea, green tea, lemon tea. Lemon tea is again Viruddha Ahara, which they put honey and drink. So, whatever Ridanas you read, you correlate it to the present day. And Rasavaha, of course, Adhyashana, Samashna, etc. all will come. Agnimandya, I need not explain. Santarpaniya, present day lifestyle such as sleeping after eating, etc. etc. Right? And Shara Lavana Yoga, as I explained, packed foods, etc. Now, Samprapti. While understanding any disease or while dealing with any disease, this Samprapti is important because it helps us to decide the treatment. Treatment is simple. Either Santarpana karna hai or Apatarpana karna hai. So, to understand what to do, you need to understand Samprapti. So, first we'll deal with Charaka. It's a Kayachik, as you know, it's a Kayachik, it's a Pradhana Gandha. So, what does it tell? Tejaa Niladyahi sa Kesha Bhumi Datvashu Kuryat Kalitam Navasya. Kinchit Daktva Palitani Kuryat Haripravatvam cha Shiroruhanam. This Shiroruhanam is synonym of hair. So, what does it tell? Tejo, that is, here he refers to the Dehoshma. Dehoshma by what it means? What he means? Pitta. Pitta, Saha along with Aniladyahi, it goes to Kesha Bhumi. And Daktva, thus burns. And it causes Kalita in Nara. Kinchit Dagda Palitani. In case if it does Kinchit Dagda, like the pathology did not happen fully, it either causes Palita or Hariprabhatva in the Shiroruha, that is in here. Now, since Charaka is a Kaya Chikitsa Pradhana Gandha, it does not deal with, much with this Shalakya Tantra diseases. So that's why we go to Sushruta. Now, after this is a very beautiful Sampradaya which is explained by Sushruta, and it is the best. It is so goated that the following authors, whoever it is, Madhav Nidana or Yogaratnakara or you name it, everyone has copy pasted the same Sampradaya, and it is so valid till date. And it is very practical. It is on point. Like, let me explain. I mean, many of you would have read this, but let me explain. Romakupa Anugam. At the base of Romakupa, Pittam Vatena Saha Murchitam, Prachavati Romani, Tada Sleshma Sashonitaha, Runnati Romakupamsu, Tato Anyasham Asambavaha, Tada Indraluptam Khalityam Rujjatesha Vibhavyata. See, here only if, in present, when you're scrolling through Instagram, you can see triad, where they tell stage, hair fall, stage 1, 2, 3, till 6. So हमको भी कभी ऐसे सोचा था ना कि हमारे संहितास में is hair fall types not mentioned or stages not mentioned. If someone asks you, show them this sloka. Why? Here Sushruta explained 2 stages of hair fall. First one is only hair fall. Romakupanugam Pittam Vatena. Sushruta also tells the same thing. Pitta. So Pitta is the main culprit here. As few of you mentioned, Pitta Shamak. Pitta Vatena Saha Murchitam, Pitta along with Vata goes to Romakupa and Prachavati Romani. It makes the hair fall. So this is stage 1, or this is one part of Sampradaya where it's very helpful in Chikitsa. So here, along with Pitta and Vata, there is hair fall. Now, until then, here block does not happen, hair will regrow. But Tata Sleshma Shonitaha. Now, if Sleshma and Shonita comes into action, they block the Romakupa. They block the अभी जो एलोपैथिक में बोलना है तो they make the active follicle dormant. Runati Romakupansu Tato Anyasham Asambhavaha. So once the follicle is being made into dormant, it does not come again. So this is what is called Indralupta, Kalitya, Rujjati. So if you see Madhukosha commentary of Madhav Nidana, he opines that Indralupta is more of patchy beard, or which happens in beard. Kalitya is on the hair. Rujjati is all over the body. Now, if you want to correlate, you can correlate it to alopecia areata, totalis, and universalis, respectively. Right? So please remember this sutra whenever you're approaching any hair fall condition. Because depending upon this, you will be deciding your treatment. So remember, is it only Vata Pitta or is it Vata Pitta plus Kapha and Shonita? अभी ये कैसे पता चलेंगे? One तो I'll explain later, stages of hair fall. One more thing is through Nidana. For example, Pitta Vata, there will be a lot of skipping of meals, etc. Right? All Apatarpaniya Nidanas will come. Sleshma Shonita, Raktavashota Nidana will come into action. Now Sleshma again, Devasopna, Dadi consumption, night time, etc. This will come into action. Right? Now let us go into commentary. So what does Nibandha Sangraha tell? He tells Kalitya, I am not reading it again, I'll just explain it. Kalitya comes only in Pumsa. The chances of coming it in stream is very less. Because Atyanta Sukumara Angayo, Rajo Dushtam Savanticha, Abhyayamaha, Ata Yasmat Tasman Kaliti Sriya. Now what does he explain? Due to the Sukumara Anga and Rajo Dushta Shravanti, the Raja Shrava happens in form of Artava. And Abhyayamata, no activity. That is, see, Vyayama does not mean here walking for 1 hour or light cardio which you are doing. Vyayama back then refers to wrestling, heavy activities. So since they don't do any activities, that and the Dushta Rakta, which is, see, this is indirect interpretation. Rajo Dushtam Savanticha. So what does he tell? Due to Rajasrava, proper Rajasrava, they don't have hair fall. Then what you should assume? If Rajasrava does not happen properly, they'll have hair fall. So Raja, you can correlate it to Rasa or Rakta depending upon the way you study. So I mainly correlate it to Rakta. So hence, Rakta indirectly plays an important role in the Kesha Chikitsa, hair fall Chikitsa. So if you go into the next commentary, what does it tell? Abhyaparena Vatapitta na Prakyupate. Due to their less or moderate activity of physical activity, and what you tell, Sukumaranga, the Vatapitta Prakopa doesn't happen. So hair fall only does not happen. Now Rajo Vimuktiacha Shrota Avroda Bhava Chitanam Api Punaha Viroha Iti. So see, first of all, first phase is not happening. Vatapitta Prakopa itself is not happening. Right? And due to this Raja Vimukta, the chances of happening Shrota Roda, as I here in the second line, Sleshma Sonitaha Runnadi Roma Kupansu Tato Anyasham Asambhava. This line, this part of pathogenesis, it's not happening due to Raja Vimukti. So, but these days you get a females lot of females complaining about hair fall, right? Indirectly, if you see most of the females HPO axis or Arthava is hampered. None of them have a proper Arthava. Only few of them has. So this is why you see a lot of cases of hair fall in female, right? So this is important. This is where you understand the importance of Rakta in Kalita Samprakti. So as I told, stages of hair fall. Pitta and Vata, it means only hair fall. So the person or patient is doing only Apatarpaniya type of Nidana. So if you get confused, you can ask the patient directly. Are you facing only hair fall or there is no regrowth? They will tell, sir, regrowth is happening, but what you tell, it's not proper. Like hair fall is happening and regrowth is also happening. Now, this one classical example which you get in OPD is like many of if the hair fall is not severe, they'll be coming to our OPD. They would have used some sort of OTC serums or anything. Like you get a lot of serums in the Insta, right? You know, like I don't remember the specific companies now. So, unme kya hota hai? You can see the baby hairs. See, there it indicates that Rakta Kapha is not involved yet. You can see the baby hairs. But the classical complaint, what they tell is, baby hairs are coming, but they are not growing. Why? Due to there is no poshana. So Vata Pitta, it's acting actively, but there is no poshana. Hence the baby hairs which have come, the follicles are active, the baby hairs which have come, but they have no nourishment to grow into a full-fledged hair. And few will come. They tell hair fall is mild, but there is no regrowth of hair. Then what you will understand? Rakta and Kapha involvement is seen. Right? See, you would have told when I had told Nidana Samprati, you would have told probably Dr. Tejaa has a lot of free time. He keeps asking all this. See, sometimes when you have free time, you can ask all this because you'll understand. You'll get a better understanding of the subject. But not every day it's possible. Like in a camp or a busy OPD, it's not possible. Then this is the differentiating factor which you can plan your chikitsa. For sometimes even abhi aap bahut zyada busy hai to you can just see the nadi. So what happens? Simple one. If you want to do Brahmana or Apatarpana, generally in the cases of Pharma, you get Ushma nadi. Like according to what school of thoughts of nadi I have learned, you will get Ushma nadi. So then you understand that it is in Sama Avastha, either with respect to Dhatus or with respect to Koshta. So don't do Brahmana, then just give something of Dipana Pachana and which nourishes like how does Shilajit act like that. Then after some time, like give them for 15 days, they'll come back, then check their nadi. If Ushmata is not there, do Brahmana. Right? So this is the classic, this is more classical, which is interpreted in practical way. Right? So this I have seen, this is from my experience. So अभी ये मैं allopathy के slides जो डाला हूँ, this is not necessarily required when you are practicing Ayurveda, but you know, since most of your young PGs, अभी जो हमको patients आते हैं, we get a lot of Google patients. They get hormonal, they tell hormonal imbalance है, nutritional deficiency है, autoimmune dandruff, etc. They will eat our head. But to shut their mouths, you should know the basic. See, once you start telling that this, they'll understand. Abhi hum, for example, if patient comes to me and I tell him, your Vata Pitta is off, your Sleshma, Shonita is off, but unko nahi samjha, it will just go over the head. But if you tell your nutritional status is not adequate, your hormonal imbalance is there, or dandruff or seborrheic, then अभी जो भाषा वो समझते हैं ना, if we make them understand in that only, they'll understand. Otherwise, they won't come back to us. So, few etiologies are, one is hormonal disturbance, which you can attribute to the rajas or rakta. Nutritional deficiency, rasa rakta asti. Autoimmune, lupus or alopecia areata, which I had explained in the previous samprati. Dandruff or seborrheic dermatitis, that is Daronaka. Generally, in cases of, this is very important because I'll tell you one clinical differential diagnosis. Abhi, see, it's very difficult to differentiate or differential diagnose between dandruff, which is present on scalp, and psoriasis. Even though on examination, people get confused. Like dermatologists themselves get confused. One key is, in dandruff, hair fall happens. In psoriasis, hair fall does not happen. Now, you won't get classical cases in OPD. Patient would have used some steroid cream, they would have used some OTC, which they have seen in Instagram. So this is one of the easiest differentiating factor between psoriasis or dandruff. And stress, this stress, how you can interpret, as Dr. Ujjwala told, Chintanam Achintanat. This rasa, I'm audible, right? Hello? Okay. My earphone just made a sound. So, so how do you understand? What is the sthana of Hridaya? Manas, right? See, sorry, what is the sthana of Manas? Even though it is present all over the body, the main part is Hridaya. And what is the Shrodhamula of Rasa? Hridayam plus Dashiramani. So what happens is, when Manas gets triggered, it will agitate the Adhisthana which it is present. So Hridaya gets mildly affected. So if Hridaya is affected, automatically Rasa will be affected. So this is how you will understand involvement of stress in Kalitya. And Rasavaswadas Nidana directly diya tha, Chintanam Chati Chintanam. Now drug induced. This drug induced is generally one second. Drug induced, it generally happens in cases of chemotherapy. And mechanical factors such as hairstyle, जो hypo नहीं डालते हैं ना, उनको they get alopecia in the front. जैसे if you can see in the background, in the PPT background, she has that is called tractional alopecia. And salon treatments जैसे steam लगाना बालों को, that is totally contraindicated according to Ayurveda. If you see Dinacharya, if you use Ushna Jala for Shirasnana, it will cause harm or loss of bala to Kesha and Netra. So that you should ask your patients to avoid. And keratinization, etc. वो सभी जो treatments करते हैं वो सब बकवास है. Just they do it for the namesake. In fact, it creates more damage than what it does. Right? So this is etiology, Nidan. So there is something called hair biological clock. I'm not sure if you're aware of it or not. If you just know the names and what is it, it's enough, because you should explain. This is for our safety. I'll explain you why. So there is 3 phases of what it called anagen, catagen, telogen, and exogen. So anagen is the active hair phase where hair grows. So this varies from part to part in our body. Like eyebrows, mein anagen phase lost shorter. That's why eyebrows ka baal kam hi hota hai. Eyebrows ka ya jo sharir ka baal hota hai. Whereas in hair, anagen phase extends for a long period of time, hence our hair keeps on growing. Now, catagen is the phase where it is transforming to telogen. It's a transformational phase on a wake basis. Now, telogen, this telogen is a phase where the hair gets ready to fall. And exogen is the phase which is shedding. So, basically, anagen is the growth phase, catagen is the transformation phase to telogen. Telogen is the, what you say, ready to shed phase. Exogen is the shedding of telogen is called exogen. So most 80% to 90% of the hairs will be in anagen phase only. So there is 2 terms called anagen effluvium, telogen effluvium. So telogen effluvium is what it happens. See, when your body undergoes stress, there is some term called stress hair fall. which you get after suffering if your body is subjected to stress like mechanical such as fever, etc., or psychological stress. After from 6 weeks to 6 months, you can experience severe health fall. That is because when you, as you know, it is achetana dhatu, hair is achetana dhatu, it is mala, and it's a vestigial organ. So body focuses more on nourishing the primary organs, that the nourishment to hair gets cut off, right? So ये सब anagen phase से telogen में चला जाता है. Then last it is shed. So this is what is called telogen effluent. Now anagen effluent is something which happens when you take chemotherapy, etc. So this telogen effluent is itself is called uh, stress hairfall. So generally, why this is to help? You remember this because generally, according to allopathy, जो hairs that are falling, you can't protect them. So only you can nourish the hairs which are newly about to come. So this you keep in mind. For example, see, not every time our chikitsa works. Frankly speaking, not every time we get results. So we might, jaldi mein we might miss some. So when patient comes to you, tell, hair has three phases: anagen, catagen, telogen. Now what is happening? Telogen effluent is happening. For example, if निदाना के हिसाब से बोलिए. Now what hair fall is happening? We can't stop it. बोलिए. It does not apply to us. Why? I'll explain you later. So you tell them that what hair fall is happening, you can't stop it, but we'll nourish the new hair follicles. Now they listen to anagen, catagen, telogen, they Google, then Google also shows the same thing. They'll be happy, they'll think doctor knows something, I'm in safe hands. So that is why Arvachan Shastra, that is allopathica, little knowledge is needed. I'm not asking you to go deep dive into anagen, catagen, telogen and read about it. This much knowledge is enough to convince patient. Because you don't work on this, right? You work on Vata, Pitta, Kapha and Shonika. Now, classification of hair fall. It is two. Non-scarring, that is due to androgen. Non-scarring matlab scarring nahi hota. You have chances of regrowth. One is due to androgenetic, that is male hormone DHT. Alopecia, areata totalis universalis. Telogen, anagen effluent, I had explained. Permanent scarring is where the permanent destruction of follicle happens. Now test. This is why I mentioned because these days you can see a lot of this in Instagram. Hence, hair porosity test. Now what is this? You pluck a hair, you keep it in a bowl and wait for 2 to 4 minutes. If it's if it's floating, it is low porosity. If it sinks slowly, it is good, medium porosity. And if it sinks faster, it is high porosity. Now porosity test ka matlab kya hai? Like, see, in the shaft of the hair, the cells are arranged, right? The gap between those cells acts as a major test for porosity. Abhi low porosity kya hai? Cells are tightly packed, so water is not penetrating into them and it doesn't sink. High porosity mein, it is it spaced a lot between each, so water is going inside, it's sinking. Abhi inse humko kya lena dena hai? Not really much. See, any movement or any arrangement or dearrangement is done by Vata. If you see Vata Kala Kali Adhyaya and Vayu Karma, any movement is done by Vata. So what you should do for Vata? Snehana. Ask them to apply hair oil. And then patient will ask, this is my low porosity, can I apply this, etc. So to shut them only, you should tell anagen, catagen, telogen that I'm a doctor, I know, follow my words. Now hair elasticity test, what is it? You just pluck a hair and you pull it between your fingers. If it breaks, it's fragile. If it doesn't break, it is proper. Now pull test, this is what we do. This is basically a child's test, like how you play around. You should just plug the hair. How many, jitna aa raha hai, that indicates the severity. Generally, no one gets that easily on pull test. Like if you want, you can try on yourself. So these are the basic tests which patient comes to you. That's why I mentioned in this so that you should not sound dumb in front of them. So when they say hair porosity test, you should not feel ye kya hai. That's why I mentioned. इनसे कुछ हमको ज़्यादा लेना देना नहीं है. So what allopathy does? Minoxidil, right? Everyone would have been aware. Now oral finasteride, this is a new drug, like new drug in the sense in the recent studies. Now this they can't even people who are planning for who are planning for conception. Because it has effects on the fertility issues. The supplement they give, B complex, A to Z supplements they give. They give steroids, topical steroids for hair growth, and the recent one, platelet plasma therapy. And there's a new thing called GFC, growth factor concentrate. So I'll just explain vaguely what is PRP and GFC. So platelet-rich plasma, you would have heard of it. So basically, they take the plasma. So according to allopathy, the phases of it during this ACT, anagen, catagen, telogen. For in the anagen phase, for growth of the hair, you need all these PGDF, EGF, EGF, TGF factors for the growth of it. So they just directly inject this. कुछ नहीं कर रहे. They just take the blood from you only. Then they take and they inject on the scalp. Now, if you're, it's like there is no point. If you're correcting from inside, it is fine. It's like watering a tree to its leaves, not to its roots. If this is of no use, because 6 months again you should repeat. And I have a few of my patients who have done this and come back to me. One allopathic doctor itself has come to me for consultation, taking PRP. She found no result. Now I'm treating her. Her results are good. Now, what is growth factor concentrate? It is same as PRP, but only growth factors are removed and it is applied. Same story. You are just watering the leaves and not the roots. There is no point. Transplant, you would be knowing. So, and yes, now since many of the lab investigations are, many of the laboratories, they give a Hairfall package 3,100 for 3,100, etc. See, our patients are such a shallow people. They do everything not to come to a doctor. They get their blood test done. They take supplements. They do everything. फिर भी they don't get any results. See, that is the importance of Nidana Parivarjana there. See, for example, now I will be explaining formulation. For example, take someone had told Bringrajasva. For example, recently I got a patient. She has been taking Bringrajasva, but he had come to me. I had written Bringrajasva since I write it a lot. She told I am already using. I told her, use this in the given instruction, you will pakka find relief. And after 15 days, she got relief. I'll show you the case also. So, when people come to your OPD, they would have done all kinds of circus. So, they get 10 pages of printouts. I zone out while saying investigations, frankly, because we don't work on those. Like, see, whatever it is, B12 deficiency or etc., we don't work on those factors, right? We see through Vata Pitta Kapha, any sort of Pitta. So, but for your understanding, I have broadly categorized into this. So, when our patient comes with CBC, B12, serum ferritin, zinc, etc., you can understand in terms of Rasa and Rakta hamper is made, right? You can take screenshot or you can get a recording, right? Then you take a screenshot. This is not exactly correlation, but it on a vague basis. And as you know, in thyroid also, they have Hairfall. What you will take? You can understand it as Medo Vruddhi had happened. Generally, thyroid have Sama Rasa Lakshana, Sama Medo Lakshana. You can understand as Santarpanjanya Vikara. And Asti, obviously, vitamin D and calcium. So this is this is very relevant. Now this slide is very relevant in present day because harmful chemicals of present day. क्योंकि अभी जो shampoos मिलते हैं, 1 second. So why is this relevant in present day? The concept of Garavisha in any disease, for example, be it be Pandu, be it be Hairfall, be it be anything, Costa. There are a lot of chemicals and preservatives and additives which are adding into our food. So hence you should be aware of this. And the consumers who are coming, they are also very ingredient specific. So when they come and ask you whether they can use this shampoo or not, generally it happens, right? They ask you. You should be aware that whether you can use this or not. So I have given a common examples. Now, surfactant is something which causes foam in shampoo. अगर उसमें sulfates है तो you can ask them to avoid because it strips off the natural hair oils. Now, preservatives, parabens, aldehydes that you can figure out. Now, in dyes which has resorcinol and toluene, they give allergic reaction. So, ask them to avoid which contains this. And silicones, they generally add it in shampoos for smoothness. So, if they have something like that, ask them to avoid. So this is why just instead of all this, I customize shampoo for my patients and give. That is a different story. Now, any Viruddhahara induced or any drug induced, you can take it as Garavisha and you can treat it. Because Viruddhahara, one or the other form, acts as a Visha. So you can take it as Garavisha and treat it. In my last presentation, I had shown a lip case where I treated in the form of Garavisha. That patient had been to 2-3 dermatologists. एक तो लेजर किया था, I don't know why. I don't know why people do laser. And one more I treated, no result. They had referred to me, and I have treated. I got it successfully. Now I'll publish the case and I'll share it to you all. Now, अभी निदान हो गया, संप्राप्ति हो गया, lakshanas I need not explain. So these are the mistakes which I made in my internships, which made me become a better doctor. So that is what happens. You should learn from your mistakes. See, if any drugs works, you need not worry. If you need not worry, also it's fine. Why this medicine or something has worked? But if you don't do retrospective analysis of why a drug did not work or why your treatment did not work, it's very difficult to grow. So that's why I wanted to share few of our mistakes. Because people will forget what I teach, but people won't forget any mistakes. Like if someone points out, people won't forget easily. That's why I included this. So let's see. Please open your chat box. First case I'll present. So this is a medium build patient, sedentary lifestyle, complaints of hairfall. On Pariksha, Rasa Rakta Shaya was seen, Amlapitta was seen, and prescription was given Datriloha and Bringraj Aswa. But मुझे इतना result नहीं आया. Until now you had listened to me speaking. Can you please explain why? I mean, can you guess why? Kafavaran good. Yes. Oh, thank you, Dr. Jasprit. It needs apatarpana chikitsa. I mean, I won't do apatarpana chikitsa in case of Rasa Rakta Shaya. If you have why to do apatarpana chikitsa, please let me know in the chat. Kafavaran, not exactly, but yes. Yes, Medas wasn't treated, yes. Because it's a mediumly built patient of a sedentary lifestyle. Meda Vruddhi was there. In fact, when I had given Bringraj Aswa, she had picked up weight and her Hasti was not addressed. Hence, even though I targeted Rasa Rakta, Rasti was not addressed and hence I could not get the satisfactory results. Sedentary lifestyle may have led. Yes, but there is Rasa Rakta Shaya, no? I don't know. I don't know why. Can you explain more? Sedentary lifestyle है, I'm not denying. But Shaya अवस्था में तो अपतर्पण किया तो फिर और it will worsen, right? So moving on to the next case. Treatment is not same for all patients. It depends upon causa. That's what I'm explaining since my first slide. So this is one more case. So it's a person of Pittavata Prakriti, 22-year male, complaints of hairfall, Alpashana, Vidahi, Drava Okay. This case I'll explain once again. So Pittavata Prakriti person, 22-year-old male, complaints of hairfall. Nidana is Alpashana, Vidahi, Drava, Ushna. What I prescribed, this was in my internship long back, so I made few mistakes. Avipattikara Churna, Tapyadiloha, Astiposhak, later followed by Datriloha, Astiposhak, Anataila. Can any of you tell why there was no satisfactory results in this. मतलब उपशय आया था जितना मैं एक्सपेक्ट किया उतना नहीं आया था. Can you please explain? Any inputs in the chat box, or I'll just move on. नहीं अग्निदीपन तो हो रहा है ना. अग्निदीपन Agni was fine, but Datriloha acts on Agni also, and his Agni was fine for that case. Nidana Parivarjana was done. Maybe I had to be more specific. No Shroto Shodhana Namapachan. Namapachan Nidana was not. Nama का निदाना इतना नहीं है ना. निदानास देखो, you will get the clue. रक्त untreated, yes. Dr. Chavi Saxena and Ranjita, yes. रक्त was untreated. मैं जो दिया हूँ वो रक्त जितना दुष्टि हुआ था, it was not satisfactory. क्योंकि पित्तवात प्रकृति, the susceptibility of him getting affected by pitta and its आशय भाव due रक्त, he has a stronger susceptibility compared to any kapha vata prakriti. And जो मैं ताप्य दिलोह ये सब दिया, it was not sufficient. Once I changed my line of treatment, I got good result. Good. Lecture is worth, I guess. So this is a third case. Female, 22. Avastha of patient is Pandu Sama Avastha. Sedentary lifestyle, Guru Adhyashana. Prescription मैंने बस एक ही दिया था since I was in the phase of learning. And this was a free consultation. Again, in internship, no one pays you. I had given manol and hair oil. Result, hairfall तो stop हुआ था, but her periods did not happen. Can someone explain why? नहीं रस दुष्टि मतलब है. Can you explain, Dr. Ujwala? Sama had to be treated first. Hairfall to stop. No, hairfall did not, I did not mention hairfall did not work. Her periods did not come by. That was my question. Hairfall it worked. निदान पंचवंचन नहीं. हेयरफॉल तो रुका है पर लेकिन periods did not come. That was my question. Yes, Dr. Swapnali Jogi. Medo Vruddhi, or you can, yes, Dr. Jwala, yes, Avrod. Yes, Avrod, that happened. This is not an ideal chikitsa where, see, dosha shamana had happened. Hairfall stopped. Yes, Shrotaroda due to kapha had increased. Yes. Meda, see, what I tell. Hairfall was stopped. But periods did not happen because there was excessive brahmana in Samavastha. So this is not an ideal chikitsa where one dosha shamana happens and another dosha prakopa happens. So rasa and Shrotaroda happened, due to which Artava being Upadatu did not result. Later I had given Arishta, it got resoluted. So generally, why I had mentioned these mistakes, because you should target each and everything which you get in Nidana. So now coming to Chikitsa. So Sushruta explains this Chikitsa under Shudraroga Chikitsa, whereas Charaka mentions it under Trimarmiyam. First we'll see Charakas first, followed by Sushrutas. So Kalitya Palitya Valyam Harulomnita Shodhitam Nasyatailahi Shirovakra Pralepahi Cha Upachari. Charaka tells us that a Kai Chikitsa physician, he does Shodhana first, followed by Nasya, Taila, Shirolepa, etc. He tells more of a Kai Chikitsa Grantha base. Whereas Sushruta tells as a surgeon, he tells more of Sthanika, followed by Rasayana. Now what does Sushruta exactly mention? Siram Murti. Like any type of bloodletting or Vidyakarma or Prachanna, that is up to you, Jalauta, etc. After Sira Murti or Prachayatva, he asked to put Lepa. with some arecha, etc. Then after that, he asked to do Rasayana Prayoga and Taila Abhyanja he asked to perform. So this is the classical. So on the similar basis, I will explain my treatment which I follow. So Chikitsa, what options do you have? Shodhana, Stanika and Aushadhi. Shodhana, you can do Vamana or Virechana. When we will do Vamana in case of increased Kapha, Virechana in case of Rakta Pitta. Nasya, either you can do Rechana type of Nasya, Tarpana type of Nasya. Rakta Mokshana in form of Siravyata or any Vidya Karma. Stanika. Stanika, you can do Murni Tailas, Lepa, Vidya Karma. Now, why, when to do this Chikitsa, that depends upon your drifti, which we'll discuss in further question and answer session. Aushadhi, what do you have depending upon condition is first Rasayana Prayaga and Garavisha Chikitsa if the patient presents with the similar case. Now, yes, sir, this is good. But before prescribing any drug as such, for example, Triphala is Kesha, Brungraj is Kesha, Ishtimadu is Kesha, Nilgundi is Kesha, you name it, it can be Kesha. But see, all drugs cannot act in the same way, right? There is a pathology in Kalitya in a gross manner. There are two types of two stages in pathology of Kalitya. So these drugs either should fall into Vata Pitta or Kapha Rakta. So depending upon my understanding and what references I have read, I have presented two actions of Kesha drugs, which will help in understanding. This is, I mean, your understanding can be different. I'm not denying at any point of time. But this is how I understand and how I practice. I'm getting results. So Triphala. So how to understand? It is a Rasayana, right? Tridoshara. And it is not exactly Brahmana, direct Brahmana type of Rasayana. It is some sort of like Shilajit. Like it does Strota, it removes Strota Roda also, but at the same time it helps the Rasa to flow. It will make Rasa Utpatti to happen. And useful in case of Samadhatu and Santarpaniya. So इसमें भी तीन फल है, हरितकी, बिबितकी, आमलकी. So how do you understand each dravya? You can't tell Kesha, Ranjana and Leaf. So Haritaki being Anulomaka, and if you see its action when you give it, it removes the Avarana, it removes the Shota, it removes the Avarana, it does the Srota Shodhana, and it does the Anulomana of doshas. So when you feel such condition is there, you can give Haritaki. Amalaki, it is more of a Kesha Utpatti nature. Like it does the nourishment and it does the Ranjana to an extent. This you can understand by referring to Adhikara in which Amalaki is mentioned. So how you understand the drugs, action of drugs? You open textbook, read under what it is mentioned, understand how it will like, then apply. If it works, okay. If it not, your understanding is not. So Bibitaki Phalamajja is especially mentioned in Ranjana of Kesha. So these three together, if you give, it's the best. That's why in Ratricharya or some reference, it's been told that Triphala is to be consumed after the food in the night time, in Udana Kala. So thus it will act on all type of hair disorders. Like, see, if avarana is there, it will remove. If rasa flow is not happening properly, it will remove. It will nourish, it will keep the hair blood. So done and dusted. But Triphala is not usually in all cases. If it's Swastha, it's useful. So coming to our Shrestha Agra drug, Yashtimadu. So how it will act? It's again, you can understand it as Rasayana, it is Brahmana in nature. It is Tridoshara, but it is more of Kapha Vilayana in action. It will do Ranjana of it, and it will help in Rasa Utpatti, Rakta to an extent. Asti, 50-58, I did not get a clarity about it because I don't think alone Yashtimadu will act on ST. But if you see in Asti Sandhana Shushruta, he explains it, Madhuka is involved in Asti Sandhana. So hence I put a question mark. I did not get a very strong evidence to suggest Yashtimadu acts on Asti. So this is useful in case of Niramadhatu and Santarpaniya nature, but it's not Tikshna enough to remove the Avarna. So hence I have given two types of examples for you. One is Yashtimadu in Vata Pitta, Quifaline, like Kapha Rakta. So if you understand your drugs in this way, it will be easier for you. So Nasya. So Nasya, what do we give? We have very limited. At least that's what we are told to. That Nasya बहुत limited तैला से देने के लिए. You can prepare a number of if you want to. So selection of Nasyas, when do you do? When you feel that Dushti is more Sthanika than Sarvanga. Like Nidanas are more pointing Shiroroga Nidana or localized Nidanas. For example, if patient has acne and active acne and other Rakta on skin, etc., then you can assume it as more Sarvanga. Right? So Nasya, again, as I told, Apadarpana and Santarpana. So when in case of Avarna is there, what do you take? Shadbinataila. In case of if you want only Anutaila. If you want a mix of both, Yeshtimadapadaila. This is as simple as that. You follow this, you will get results. Now, Aushadhi. As many of you told, Pitta Shamak, etc., when you consider all these factors, right from Agni to Asti, when you decide these factors and give, then only you will get a proper result. If you even miss one single factor, no, just as shown in my mistakes, you won't get results, satisfactory results. So, Aushadhi. I'll give a few examples on how to understand Aushadhis. Rest you can work it on. So, coming to famous lohas. So, Tapya Dehe, Datri Loha, Punanava Mandura, Navayasa. When do you take what? So, Tapya De Loha. It contains Kasha Aushadhi plus Rasha Aushadhi. So, when can you give? If you see in the ingredients, few are Ushna, Tikshna, Amapachana, etc. So, when can we give? In Samavastha Rasa, that is the first and foremost you can give. It cleanses basically it does the Deepana Pachana at the level of Kosha to an extent, and it acts on Rasa and Rakta Dhatvagni. And it's a Rasa Aushadhi. And it's little Tikshna in nature, so if Rasa Rakta is not proper, it will go settled. So this you can give, for example, in cases of the third case, which I have told, Hairfall has worked, but she did not get her periods. So in that case, Tapya Diloha would be good. So Datri Loha, when you will give? If the person is having Agnimandya, if the person's food is not proper, if you see Datri Loha Falashruti, if you take it after food, any problems arising out of food, Annapana, it will be cured by Datri Loha. So when do you give? If Agni Dushti is there and Pitta Ushna Guna is increased. Right, for example, what do you say? Excessive heat exposure. For example, a person is working in a mine or in the kitchen, in the restaurant, where there is excessive heat, Pitta Ushna Guna is triggered. In that case, you can give Datri Loha, where Pitta Ushna Guna is triggered. And if the person has Agni Dushti, this will set Agni Dushti also, it will set Ushna Guna of Pitta also. So, 3 targets, 1 medicine. And it's a Tridoshahara also almost. And if the hair fall is present along with Palitya, you can give Datri Loha. Now, when do you give Punanavadi Mandura? So, when Pitta Dravaguna and Ushnaguna to an extent it's increased, Pitta, then you can give Punanava Mandura. Now, why am I targeting only on Pitta? Because it is one of the main culprit in hair fall. So, it does Deepanan Pachana at the level of Koshta, Rakta, Rasa. Mild Agni Dushti it will take care, Sama Rasa it will take care, flow of Rasa it will take care. And coming to Navaya Savaloha, it will do Amapachana and Lekana and Sattvapanota cases you can do, such as in hair fall in case of Staulya. You will get patients who is Staulya and having hair fall. Then in them, apart from Tapyadi Datri Punanava, Navaya Savaloha will be good choice of drug initially. Now other Aushadhis. This I had given example. You can you can use any drugs you want. Now, what is Bringarajasava? What is its action? It's Dikshna. It removes Avarna. It is Rakta Shodhaka in nature. And Bringarajasava as a drug, it is useful in Shaya Avarsa. That's why when I had given in a mediumly built patient, when I had given before food, or I don't remember before or after food, it caused the staulia and it worsened the case. So you should keep this in mind while giving Brungraja. Same with respect to Kumarya also. It is Tikshna, Vedana, Avaranhara. It's a Rakta Shodhaka in nature. Ideally, not to give in Saulya. And if a person is having Atava related issues, I mean, if she is having Atava related issues, Kumari Asava is a drug of choice, provided that is that Atava is due to that Atava issues whichever is occurring is due to Apatarpana Nidana. In case if it is of Santarpaniya Janya Atava related, if you give Kumari Asava, you will worsen hairfall, you will worsen her Atava also. And for Asti Poshana, you can give Shirabala, you can give Kokomo food, you can give Bonton, Asti Poshak, etc. Anything which you find it's good. So, Sushruta has mentioned Rasayana. So, what Rasayanas do we have? Rasayanas we have a number of Narasimha Rasayana, Agastya Ritaki, Shivagotika, Chandraprabha, etc. But when do you know what to give? So, you should understand the Rasayana formulation like this. So Narasimha Rasayana, since it's famous, I have taken this. It's mentioned under Rasayana Adhikara, Ashtangradaya Uttarasthana. So what are its benefits? Kesha shines like Brangaraja Neeli. That means it blackens. Now, important drugs to remember in this is Ballataka Chitraka. That is due to the safety standards. It's Tikshna. And it is done in processed in Brangaraja and Vara Swarasa, Vara here is Trifala. Due to its action, you should remember these two. So, what is its guna and karma? If you go through formulation, you will understand it can do Shrota Shodhana due to the virtue of the virya of the drugs. It can do Rasayana, it can produce Rasa, it can make Rasa flow and Brahmana in nature. So, as I told, mode of action, Rasayana quality wise, flow of Rasa quantity wise. Quantity wise, here Hayangavena is mentioned, that is the butter which is prepared from the previous day's dadi. So what is butter's property? It is Dipana, Hrudya, Sangrahi, Ashas and Rasadhatu. It improves Samanya Guna. So for example, if someone comes of a Santarpani like a sedentary lifestyle, etc., if you give Narasimha Rasana, you will worsen the case. So I have seen in many, I mean, I'm not criticizing anyone. Maybe it have worked out for them. But a few patients, when they come, like they had consulted another doctor for Hairfall, they come to me. यही होता है सब ब्रह्मणा वाला ही देते हैं नासिम रसायना कुमारी asava etc. I did not see anyone prescribing कुमारी asava. Bringraj asava is what I meant. ये सब ब्रह्मणा कर देते हैं और Hairfall won't reduce. Why? They would not have decoded the Samprapti. So that is why it took so much time to explain Nidana and Samprapti. Now, we have seen the mistakes. Now we will see success cases. Because itna मैं बोला हूँ. Now I should show you the results, right? So this is a case of 37-year-old male. Complaints of male pattern balding. ये तो chronic case है. He had used minoxidil etc. 5+ years. So Nidana and Dosha Dushya क्या है? Main on Prashna Pariksha could elicit Rakta Dushti and Pitta Dushti, which is obviously main part of Samprapti. And in Nadi, when I checked, I could get Ranjaka Pitta hampered and Astidhatu in the Nadi and Sama Abhasa. So here, Ranjaka Pitta, if you understand, or what I was taught in my Nadi classes, that it is a Dhatu Agni, because it converts Rasa to Rakta, and when like this goes more towards Nadi, basically, Asti Poshana was not sufficient. So he had come for my Chikitsa, I had given Aushadhi, Viddha Karma, and Pratimashanasya. So this is within 1 month, 1 month of duration. See, if you see the before picture, I mean, this patient has actually 2 months हुआ है अभी मतलब I'm treating from since he got a good results, he did not come for a follow-up. So I don't have the second picture. So if you see in the first picture, you can see the skin is wrinkled. What does skin is wrinkled? There is no active hair follicles. और बिल्कुल भी प्लेन है. मैं इसलिए फ्लैश भी ऑन करके I took photo. It is plain. It is plain as a cricket pitch, right? Now this is after 1 month of chikitsa. If you see, there are new hair follicles, not new hair follicles, dormant follicles, which is becoming active. See, I have zoomed in. See, there are a lot of n number of follicles that are coming out, which was not there at present. That too, this is with no PRP, no grade GFC growth factor concentrate, no hair transplant, pure Keval Ayurvedic Chikitsa with Aushadha and Vidyakarma. I did not even go for a full-fledged Nasya or Virachana because the patient was not willing to. Like, this is, I'm not boasting, but this is a very good result. कि एक महीने में आप इतना छोटा छोटा follicles जो dormant है, that is sustained. I mean, that is क्या बोलते हैं, revitalized, and it is opening up and coming. And what does patient do when he gets results? He stops coming. So it's been 3 months. After 2 months, he stopped coming. I wanted to present this case to a paper, but let's see if he comes back. So what you will do is when these small hair follicles, hairs are coming, right? Then you should do अच्छा से ब्रह्मणा करना है ताकि जो नया hair follicles आ रहा है ना, it will come properly. So this is on left side, I guess. 1 second. This is right side. If you see that frontotemporal recession which is present, that recession come होके आगे आया था. Like it has, that hair has come forward, the hairline. If you can observe, you can see the thickness of hair also increased. The density of the hair follicles have also increased here. And this is the क्या बोलते हैं, the आवर्ता होता है ना सिर पे, आवर्ता होना. There it is there. I am zooming in here. If you can see, you can see small hair follicles which is present here. New hairs that are growing. I can't mark it. If you want, I'll mark and share the picture to Dr. Hairfall ma'am. She'll forward it to you. This is after Vidyakarma was done. So if you prick, I mean, after this was after 4 sittings of Vidyakarma, I guess. This was sab nahi. My phone could not. Probably have taken a DSLR. But there are many n number of small hair follicles which are arising. New hairs that are seen. So, a 1 month span mein, it is a very good result that is approved by a dermatologist also. Now, here this photo why I am showing is to highlight the importance of Shirabhyanga. Abhi, the left is before and right is after. Now, if you are a keen observer, this patient had did Shirabhyanga continuously for 15 days. Not continuously, but frequently. If you see on the left side, that hair just looks like a dried grass. There is no life in it. Very, is a dried grass जैसे दिख रहा है. But if you see on right side, the color of the hair improved. The density of the hair is better. And it looks very lively. So this is the importance of Shirabhyanga or application of hair oil in hair fall conditions. It looks very lively. Even वो देख के मैं खुद ही शॉक हो गया था और मैं हर दिन शिरोअभ्यंग करने का चालू किया था. So this is, see, we take all this Shiroabhyanga, Shirodhara, Nasya for granted. It's not like that. They're very therapeutically helpful procedures. Abhi, this is one more case to female patient, 26. ये online consultation था, इसलिए तो my photos were not on point because, you know, once you take online consultation, they won't send you photos properly. ये complaints of hair fall since 1 year. Nidanata Agnimandyata, Shreya Vasta on Prashna Pariksha. Since it's online, I could not do an RD Pariksha. Chikitsa, maybe I was limited. I could not do with the Nasya bhi ready nahi tha. So, isliye I had given just Aushadhi. So, and I had forgot to mention our HB was some 8 or 7. So, this, as I told you, it was an online consult. My photo clarity is not on point. This is what the patient sent. So hence its little resolution is less. So this is just 15 days of treatment. I repeat, only 15 days after treatment. That too our HB was 8.
I corrected her Agni. I had broken the Sampratya, I had given Aushadis. So if you closely see him, this is what I was mentioning to you regarding tractional alopecia. मतलब इधर ही आता है हाँ, इधर ही आता है वो at the front of the frontal. So it was very thin and it was almost like a bald spot on her. Now after 15 days of chikitsa, if you see the below, there are new hairs coming up. Her hair density has increased. Her color of hair has become better. This is only 15 days and her HB was 8. So this is why I'm telling you, don't give a consent to what allopathy tells. हाँ ये बाल नहीं आता, ये सब छोड़ दीजिए आप. संहिता लीजिए, पढ़िए. Be daring and dashing. Don't over promise, but be confident enough to promise to deliver results. Only in 15 days I got this much, and the patient was very happy. Now she is planning to take a full-fledged in Nasya. So this is what happens when you show results. People will take. I mean, initially it will be difficult as a new practitioner, but you see, that front spot which was almost bald, now many baby hairs are coming up, and the density and the color is also has improved a lot. I don't know whether you are able to appreciate it. Even to appreciate results, it needs a trained eye to see. It needs a training in dermatology to see. So ये था postpartum case था. Complaints of hair fall, little balding in frontal area. I had taken 3 different types of cases because you'll know the efficacy of treatments. See, one thing, first I had taken Vidya, Nasya and Aushadhi. Second, only Aushadhi. This one only I since I prepare Ayurvedic cosmetics also, I had done an Ayurvedic hair serum and I had given this. Since she is postpartum, she will have a little Shaya Avastha. But the patient was not ready to use medicines. As you know, people who are in their home tells Ayurveda medicines heat karte hai, ushne karte hai, nahi lena hai baby ko. So I left it. I anyway wanted to experiment. So I only gave Ayurvedic hair serum. Now on the left side, you can see thinning of it. Yes. Again, online consult, reduce the resolution. You can see thinning of hair. You can see balding of hair. Balding of the spot. Now on the right side, if you see, there are many baby hairs coming up. The density of hairs has increased. And if you see, our hairline had come forward actually. ये तो मैं खुद भी शॉक हुआ था कि सीरम से इतना रिजल्ट आया. Her when you can see the front hairline curving down to the temples, right? That if you observe properly, our hair line has come front. Yeah, I think it was around 1 month she was using serum. She did not give a follow-up. When I asked for case presentation, she had sent me. So this is the power of Ayurveda. सिर्फ स्थानिक चिकित्सा मैं बस आयुर्वेदिक ड्रग से यूज किया. मैं कुछ मिनॉक्सिल नहीं लगाया, रेडनिसोल एक्सेट्रा मैं कुछ नहीं डाला था. मैं बस आयुर्वेदिक ड्रग्स यूज करके मैं जो प्रिपरेशन बनाए वही दिया था. So this is the effect of स्थानिक चिकित्सा. We often tend to overlook. क्या हम सोचते हैं हेयर पैक बोले तो क्या है, बस हफ्ते में एक बार लगाना है, वो भी just that's a posh thing. Like if you follow what is told in classics properly, it will yield results like this. Now this is how we do with the karma in hair fall cases. If I start telling this will only take half an hour, 40 minutes. If you people are interested, we can plan a separate session of with the karma in hair disorders. कैसे करना है, क्या करना है, वो सब हम plan कर सकते हैं. So basically, this is one of the ways of how we do with the karma. This is a case for dandruff and hair fall. As you can see, there are flakes in there. And now coming to Patya. What is the importance of Patya? Patyam sati gatatasya kim aushadhi nishevati. Apatyam sati gatatasya kim aushadhi nisevati. If you are following Patya, why to take medicine? If you are not following Patya, why to take medicine? There is no point. So to prevent recurrence or to maintain a healthy hair, Patya is needed. So as you know, Agni is mainly Agni Palana is done by Ahara, Rasa is by Ahara. and once rasa is proper, everything will set back. So lastly, इससे मेरा जो मैं बोलना था मेरा हो गया. I would like to be grateful that you can see the screen. First one is Dr. Ramani. She is a dermatologist, allopathic. She is my mother. Probably it is due to her I have got an interest in skin and hair. So her name is she is my mother. And Dr. Srinagesh K.A., Dr. Savita Shana, and Dr. Sriyasha. These are my gurus in my college. I mean, other teachers also taught me SNIA, but like by proper under the interest to read Samhita were ignited by all these three people, and they had guided me at different stages of my Samhita Adhyayana. Probably you would have listened to Dr. Sriyasha sir. He has given a lecture on Rasayana in Charak Samhita. And last 4 days, Dr. Amol Bansode sir. From him I have learned Agni Karma and Vidya Karma. He is a very good teacher due to by the virtue of Vidya Karma. It's one of my specialties. Practicing in Hyderabad, giving results in Hairfall or any cases, it's very good. So I bow down to all of them, and I'm very grateful that I have been, faithful. Well, my destiny was so good. I have landed in their hands, and by this I conclude my seminar or webinar, and session is open for doubt. I once again thank Dr. Hetalji. She had given me an opportunity, to give a webinar. Thank you so much, Dr. Hetalji.
बहुत बहुत धन्यवाद, बहुत अच्छा एक्सप्लेनेशन देने के लिए. और जो हमारा विश्व आयुर्वेद परिषद की ओर से चलने वाली इस व्याख्यानमाला का उद्देश्य है कि अनेक श्रेष्ठ वैद्य निर्माण हो और भारत के लोगों की चॉइस आयुर्वेद सबसे पहले हो. कुछ भी हो उनको तो वो आयुर्वेद के पास सबसे पहले आने का और इस ट्रीटमेंट को जो भी कोर्स है उसको लेने के लिए सोचे. तो सच में बहुत ही बढ़िया प्रेजेंटेशन.
थैंक यू सो मच
जी. एक्सप्लेनेशन एक्स्ट्रा ऑर्डिनरी है. और बीच बीच में ही हमारे पार्टिसिपेंट्स ने लिखना शुरू कर दिया था. डॉक्टर जसबीर ने सबसे पहले लिखा था कि नाइस एंड वेरी गुड प्रेजेंटेशन. और आपने पार्टिसिपेंट्स की इन्वॉल्वमेंट करके मीन्स बिल्कुल बांध के रखा, जस्ट लाइक क्लास, है ना. क्लास में वरना 40-45 मिनट भी बच्चों को बिल्कुल पकड़ के रखना, बांध के रखना थोड़ा सा दिक्कत वाला काम हो जाता है. मगर आपने बहुत अच्छे तरीके से किया. कुछ क्वेश्चन चैट बॉक्स में आए हैं डॉक्टर साहब. और मैं सबसे पहले डॉक्टर वृंदा राव जयपुर में बहुत अच्छी प्रैक्टिशनर, बहुत अच्छे यूट्यूब के ऊपर पथ्य बताती है और मेरी फ्रेंड भी है. तो डॉक्टर वृंदा, आप कुछ हमारा ज्ञानवर्धन भी करना चाहे या कुछ पूछना चाहे तो आप वेलकम है. आप अपना वो ओपिनियन रख सकते हैं. डॉक्टर वृंदा जी.
हाँ, सभी को नमस्ते.
नमस्ते डॉक्टर वृंदा जी.
आपका बहुत अच्छा प्रेजेंटेशन मैं सुन रही थी शुरू से. बहुत ही काफी चीजें आपने लिया. एक मैं आपको थोड़ा सा ऐड ऑन करना चाहूंगी मेरे एक्सपीरियंस से कि कुछ डिजीज हैं. हिस्ट्री टेकिंग बाल हेयर फॉल में बहुत इंपॉर्टेंट है क्योंकि आपको ढूंढना पड़ेगा कि हेतु कहाँ से आ रहा है. वो जो चैनल है संप्राप्ति जिसको हम बोलते हैं, वो चैनल कहाँ से आ रहा है. और इसके लिए मैंने देखा कि जीर्ण प्रतिशय का एक कॉम्प्लिकेशन के रूप में हेयर फॉल आता है. ऐसा देखा है. और जॉन्डिस और टाइफॉइड के भी कॉम्प्लिकेशन के रूप में हेयर फॉल आता है. तो ये भी एक क्वेश्चनर में होना चाहिए कि हम क्या सफरिंग ऑफ एनी दीज 3 और एनी मोर डिजीजेस सिंस लास्ट 6 months और 1 year. ऐसा मुझे लगता है कि ये भी ऐड ऑन करना चाहिए क्योंकि हम सिंपल में जाते है ना.
यस मैम, प्लीज कंटिन्यू.
हाँ, तो बस यही मैं बताना चाह रही थी क्योंकि फिर वो जो व्याधि का जो वीकनेस रिकवर नहीं हुआ या उसको फिर रिकवर करने से फिर हेयर फॉल रुक जाता है. जैसे जॉन्डिस में 2 से 3 महीने का जो ठीक होने के बाद भी या टाइफॉइड का भी 21 दिन का प्रोटोकॉल के बाद भी जो रिकवरी फेज है वो पेशेंट नहीं करता है तो फिर ये हेयर फॉल एक उपद्रव के रूप में मिलता है. ऐसा मैंने देखा है. तो ये ऐड ऑन करना था, बाकी बहुत अच्छा आपका रहा, काफी जानकारी मिली, है ना?
Thank you, ma'am. I was not aware of that Jina Pratishaya. Thank you for the input, ma'am.
यस यस, जीन प्रतिशय से पालित्य, केशपतन, मेमोरी लॉस एंड विजन, दृष्टि दौर्बल्य, ये 4 कॉम्प्लिकेशन मिलता है. यस,
Okay. I was not aware of that. Thank you.
चलिए ठीक है ना? नमस्ते.
धन्यवाद डॉक्टर साहब. इसमें से बेटा आप लेंगे चैट बॉक्स खोल के?
I'll take it, ma'am. No strain for you. I'll take it. ये सब अरेंज करने में आपको बहुत स्ट्रेन लगी. So, saline figure, male pattern baldness with the karma done. Please explain more on this. मतलब आप क्या पूछ रहे हो मुझे? You're asking me about male pattern baldness or with the karma? If it's with the karma, I've shown the points which I have taken. As I told, it's very difficult to explain with the karma again. Oh, it'll take a whole session itself. Hence, I did not elaborate on this. But if you want, we'll pakka take up a separate session for with the karma in Hairfall.
जी डॉक्टर साहब, इसको तो डॉक्टर जस्टिन ने भी किया कहा है. हम अलग से मैं आपसे फिर फोन पर आपका अपॉइंटमेंट के डेट हम डिसाइड करते हैं, तो विद्या कर्म का एक सेपरेट ही कर लेंगे डॉक्टर साहब.
Yes. What are
जी जी.
whenever you ask, Dr. Usha Allah, kal male pattern baldness be treated successfully. Abhi, this case I am getting good results. I have one more case which also I am getting good results. See, one point in male pattern baldness is you need very consistent and you should be patient. अभी जो नॉर्मल स्ट्रेस हेयर फॉल, ऐसे वृंदा मैम भी बोल रहे हैं, जो टाइफॉइड से आ रहा है या जॉन्डिस से, that is comparatively, that is, if you can understand it, it will come under telogen effluvium और रक्त दुष्टि के वजह से. Whereas this male pattern baldness, as I told, शोणिता कफ आवरण का वजह से होता है, and there is lot of रक्त दुष्टि. As you see, blood does not go out of the males. If you read the Dinacharya in Sharad Rutu, as in Swastha also, Rakta Mokshana was indicated. But we don't do it. Hence, there is, due to our Ahara and Vihara also, there is lot of, what you tell, Rakta Dushti, which is present in it. Hence, this male pattern baldness, whatever it is, it will take a lot of time to yield results. But definitely, जो मैं केस आपको पहले दिखा है ना, वो that is what is male pattern baldness. Frontotemporalization था और ये balding था. That is what is called male pattern baldness. Huh? So results are treated, but again, you should see the bala of nidana and the chronicity. 5+ years, basically, it becomes a little difficult to treat because Sushrita tells, he tells Yugma or Yuga, I don't exactly remember, but after 5 years, that what the Samprapti goes Gambira and Gambira. So next question. In Shodhana part of treatment, if seborrheic dermatitis is present, we should recommend Vamana or Virachana. So क्या होता है? Seborrheic dermatitis is again Kafasthana. So Kafasthana is ideally Vamana is indicated. But again, for example, if it's an online consultation for you, Vamana is not practically possible. Like if they have an Ayurvedic center there, it is okay. But फिर भी आपको पता नहीं है कि वो जो वैद्य उधर है वो कैसे वमना करवाएंगे. अगर वो it's not what is it, अयोगा हुआ तो उसका complications भी आएगा. So in that cases you can go for Virachana or you can go for Nasya. Which serum, sir? वो मैं खुद ही बनाया हूँ. वो serum जो है, I am yet to get it FDA licensed, etc. So I can't reveal the ingredients. I did not get IPR as such. Early grade treatment in 13 years age. See, the treatment, it always depends upon Nidana. Like, let me give you a small example. So, recently, 2-3 days back, I have got a case, like they had come for Nadi Pariksha. So, in all of them, Asti was very messed up. Like, Asti Dushtita symptoms bhi aise hi tha. And they were complaining of same calcium deficiency symptoms, body pains, hair fall, etc. Then, see, for एक के लिए हुआ तो you can understand it as वैयक्तिक निदान. 3 of them same family से happening. So I questioned and questioned. Food was same, रूक्षाहार नहीं तो स्निग्धाहार ले रहे थे, देन अस्थि को टारगेट करना है तो you should have some nidana which is common in, which is specific to asti, like how it will act through kale kapati nyaya. So then I had asked, what do you drink milk? They told, I drink milk. So I'd asked, what is the source? They told they get it from local vendor. So they told milk is good, milk is apparently very thick. Now if you see, when milk is generally adulterated by urea, they adulterate it by urea to make it thick. Now this urea will act as Visha, Garavesha. So now what you should do? You should do Asti Brahmana, or first you not exactly Brahmana, first you should do something of Shodhana, like you can give Bilvadi Gutika first, or you can give any medicine which does Shrota Shodhana and Dipana and Pachana, like Punarnavadi Mandura, etc. And then after this, or if the patient is okay, you can go for Virechana itself. But since it's an 8 years old, 12 years old, I did not advise Virechana. Then I had given Asti Brahmana. It has been some 6 days or 7 days. They had found better results. I had asked them to stop Shira. They had seen improvements. As Charaka and Ashtanga Sangra tells, either in 6 days or 7 days you should see a Upashaya. If not, your treatment is wrong. So 6 days mein Upashaya mila tha, so I am continuing the same medication. This early graying treatment in 13 years is also same. There will be one specific nidana which is causing it. So graying palita mein kya hota hai? It is only due to pitta, dehoshma. So any shita chikitsa you can do. You can give as a medicines bolna hai to you can give Bringraja, so you can give Neeli Bringadi Taila for application. You can give Trichup by Vasu Pharmaceuticals, और कामदोदा दे सकते हैं, दात्री लोहा बिच्छा है मेंशन, पालिते में है तो दे सकते हैं. ये सब it will only act to an extent until and unless if nidana is not addressed, it won't give a full cure. I hope I answered your question. Thank you, Dr. Sriram. Thank you, Dr. Kavita. Thank you, Dr. Naveen Kumar. Thank you, Dr. Chahi. Thank you, everyone. Thank you. Thank you. Oh, thank you, Dr. Ujjwal. Saline figure again, yeah. Ayurvedic hair serum, as I told, it's made of Ayurvedic ingredients only, but I can't reveal it since I don't have an IPR rate, so please don't mind me. I have told all my secrets. That is, like, it's a commercial thing, so I can't tell it. If it's respect to any chikitsa, I'll pakka tell. There is no secrets. Can elaborate. Again, thank you so much. I sell hair serum, I don't do it on business base. I give it to my patients. I'm also in stage of learning, like every doctor, even if you ask Dr. Hetalja or Dr. Vrinda ma'am who is present here, they also learn day to day. They also learn on day-to-day cases. So as of now, I'm customizing my patients and for my patients, and I'm giving. And once after experience, you will get a broad spectrum formula, and then I can sell. If you want, if you tell me complaints, I can share it to you. My number was on presentation. You can get it from there. Dr. Asha Naikodi, 16-year female, post-jaundice. She is having hairfall. Pitta Pradhan Prakriti. देखो अभी jaundice बोले तो I don't know whether it was Shakashrita or Kostashrita. You can give any Raktapachak, like for example Chadangapani आप दे सकते हैं पहले. See, if Rakta, this was one of my experience in one of the cases. If Rakta Dushti is so much, simple Mahamanjishtar Kasha, if you give also, hair fall reduces. So it depends upon the डिग्री ऑफ द दुष्टि प्रेजेंट. सो आप इधर है तो एक बार कामला का निदाना देखिए. उष्ण है तो मंजिष्ठादि मत दीजिए, वो भी उष्ण है. तो यू कैन गिव षडंगपानीय. इफ यू डोंट गेट षडंगपानीय, यू कैन गिव कूल मेलॉन. इट हैज द्राक्षा सारिवा प्लस षडंगपानीय का जो फॉर्मूला है वो है. इट विल डस पाचना एंड इट विल इंक्रीज रसोत्पत्ति ड्यू टू द्राक्षा एंड सारिवा. भृंगराज आसवा दे सकते हैं, कुमारी आसवा दे सकते हैं. इट विल वर्क. If you do, if कोष्ठगतमी अम्ल पित्ता है या पित्ता ज्यादा है, you can give कामदुदा. If you do पित्ता रक्त प्रशमन चिकित्सा along with केशा, which are mentioned, you can give. It will work. Is with the karma we'll should do one day. Just a little insight on dandruff treatment. अभी जो dandruff का treatment है, one thing it will, what I have cases seen is Agnimandya will be there. So you can do Agnimandya Chikitsa by Agnitundivati, Arogyavadinivati, anything depending upon the case presentation. I don't tell drugs because it will differ from case to case. That's what I had explained while explaining medicines. और तैला को आपको कुटित तैला दे सकते हैं, इट विल वर्क वेरी वेल इन डैंड्रफ. दुद्रपत्र दे, एज यू ऑल नो. और स्थानिक लेप दीजिए, और आपको सेटअप है पंचकर्मा तो तक्रधारा दे सकते हैं. और इफ यू फील देयर इज शोधना टू बी डन ऑन स्कैल्प, लॉट ऑफ दोषास है. आप जो भी हेयर पैक दे रहे हो लगाने के लिए, आप सिंपल भृंगराज ही दे सकते हैं, क्योंकि भृंगराज कुष्ठकना और केशा भी है. इट विल एड्रेस बोथ डैंड्रफ एंड व्हाट इट विल हेयर फॉल इश्यूज. This Brungraj में थोड़ा सा टंकन भस्म मिला के, if it's a dry scalp you can give dadi for applying. If it's a oily scalp you can give water or lime juice depending upon the presentation. ये दीजिए, टंकन भस्म ऐड कीजिए, आपको बिल्कुल रिजल्ट मिलेगा. और if any Agnimandya is there, Agnitundivati or Arogyavadini you can give. If you feel dandruff is more, give some Kushtahara like Kadira, Arishta, etc. ट्राइचुब भी काम करता है डैंड्रफ में. सो दिस शुड वर्क. सर प्लीज एक्सप्लेन. Is it Dr. Ujjwala? Is it kalpa kapha related? I assume कफा रिलेटेड डैंड्रफ अभी मैं जो एक्सप्लेन किया ना, आप भृंगराज ले सकते हो, तंकरा भस्म ले सकते हो, मिक्स करके यू कैन अप्लाई इट ऑन स्कैल्प. तक्रधारा दे सकते हो. And Palithia in kids due to junk food, देखो जंक फूड कैन बी शारान लवणति होगा, तो उसका चिकित्सा, सी शारान लवणा एट द एंड ऑफ द डे इट कॉजेस अपतर्पण, इट डज दुष्टि. सो पालिथियम आप क्या दे सकते हो, धात्री लोहा दे सकते हो. इफ द किड इज एल्डर लाइक 10 to 11 years, so आप प्रतिमाशन दीजिए और हेयर पैक लगाने के लिए दीजिए. और रसायन यू कैन गिव अगत्य हरित की रसायन, बिकॉज इट्स डायरेक्टली इंडिकेटेड पलिता अंडर इट. Or after, if it's in Nirama Avastha, you can give Narasimha Rasayana, which I have like Falashruti mein hai, it will make hair shine. Or you can give Shivagutika if it's more of Kafaja related, as you have asked. And Dr. Sai Sriram, 21-year male, early graying of hair, Karsha. Like if you see this is due to, if you understand in certain way, it is more of due to Shayaja Avastha. So you can, if there is no ama, you can directly do Brahmana with Narasimha Rasayana. If there is ama, initially you can give Punarnavadi Mandura for a few days, later followed by Narasimha Rasayana. Since it's 21 year, you can give Yashtimaduka Taila Pratimashanasya if the patient can't come to your clinic daily. If he can come, you can give Anatailanasya or Yashtimaduka Tailanasya for 6 to 7 days with 6 bindu or 8 bindu. 26 year female with Cushing syndrome or Cushing syndrome. देखो पॉसिबिलिटी ऑफ ट्रीटमेंट तो होगा डॉक्टर वर्षा सिंह, बट विदाउट निदान संप्राप्ति आई कांट टेल. You see, you analyze the case. If it's Santarpana Janya, what you can do is you can do Viddhakarma followed by application of Lepa and give Bringaraj Aswan Punanava Mandura and give Asti Potion also. Like Bukomo Fort or Bontan, anything. Other than that, without case details, it is difficult to tell in such cases like Cushing syndrome. क्योंकि personally Cushing syndrome का patient मेरे को नहीं आया, so I can't comment on that. Thank you. Hairfall in menopausal age, how do you address it? See, menopause में अभी एक तो शयावस्था होगा, then you can give rasayana, and artava does not flow out, so you should understand that there will be Pudushti also. Then you can give Bringarajasava, you can give Shatavari granules. It will act as Rasayana also, it will do Brahmana also. And you can, Dinacharya say you can help, like if it's a minor helpful, you can give Anuta Pratimashanasya. And generally in menopause, they tend to have all Shayas, especially calcium ka. Then you can give any calcium, matlab Asti Poshak such as any Bokomo, Asti Poshak, Bonton, Ostigen, etc. You can sell, we'll buy. You can contact me, Dr. Ujjwala. We can see how it will work. Thank you, everyone. Thank you. Thank you. Hair loss during menopause, how to understand? Yeah. See, I think Dr. Hetal can explain you better on this, Hetal ma'am, but I'll explain you what I understand. See, generally, क्षय अवस्था होगा जो मेनोपॉज में. So if you do just Brahmana, it will be enough. With simple Pratimashanasya, you can give as a Dinacharya. Shirabhyanga, you can give. Lepa once a week, you can give. Mainly, शयजा अवस्था होगा उसमें आपको ब्रह्मना करने से काम होगा. पर लेकिन अभी जो सेडेंटरी लाइफस्टाइल में है ना, people tend to have many santarpanota conditions in them. Then you can give some rasayanas like Shivagutika or Agatsa Rasayana, like that. Which shampoo are you using in your practice? Most people don't use Kashdavana Dravya. I did not understand, Dr. Ujjwala. Can you please explain that question? How to use Sankaram?
Namaste, sir. It was very excellent presentation.
Thank you, sir.
Very nice. And sir, ये जो like हम बोलते हैं ना, like Rita and all, Kesha Dhawan means for we use Shikekai and all. If we tell patient to use, they will not use. So they want ready to use shampoos and all. So which shampoo you for Kesha Dhawan, what you use in your practice?
Okay, Kesha okay. So I prepare my own shampoos. I have different set of formulas for different conditions. मतलब मैं थोड़ा तो शैम्पू का बेस यूज करता हूँ क्योंकि as you know, as the same concern which you had mentioned, they won't be ready to use kashaya for washing hair, especially the current patients now. So what I do is I use Ayurvedic method of preparations, Ayurvedic principle for formulating it. I use shampoo base and I prepare shampoo and I give them. And how to use Sankarmasma, जैसे कि आप लेपा जो लगा रहा है ना उसमें if you mix a little like maximum 0.5 gram if you mix and apply on the same, you can use topically, you can use. And that's it, I think. Hetal ma'am, question and answer sessions are done, I guess. Any other doubt?
बहुत बहुत धन्यवाद. हमने 1 घंटे
सर मैम मुझे एक क्वेश्चन था ये सर प्रतिमर्शनस्य के बारे में आप लाइक हम पेशेंट को कैसे गाइड करें? वो एक तो कभी कभी वो बोलते कि हमें गले में बहुत ऑयल आ जाता है तो हमें अच्छा नहीं लगता है और लाइक दे अवॉइड सो और एम्प्टी स्टमक करना है लाइक ये सब कुछ आप मेनली आप क्या प्रोसीजर फॉलो करते हैं वो बोलिए.
मैं आई से बेसिकली प्रतिमर्शनस्य पहले I'll start with dose. So it is told as 2 bindus. So आप कितने डोज देते हो डॉक्टर उज्ज्वला?
Less only, sir. Like 4 drops.
4 drops is fine. Pretty much the same dose. Same 2 bindus. If you take a finger and you drop it, you will get for 1 bindu you will get 2 drops. 2 to 3 drops depends upon the oil. So 4 drops. So what I practice is, see, generally I give Pratimashanasya to people who are little desperate for hair. Because see, if you ask a common swastha person to do, they won't be interested. Because only when you have a problem, they will do. So I generally ask them to do on an empty stomach, preferably in the early morning or at the end of the day. Like, for example, if you see Pratimasha Kalas, I had mentioned some 10 to 12 Kalas for different indication. So either I ask them to do on empty stomach or after, few people won't listen to us, that is, hamara haath mein kuch nahi hai. I ask them to do in the evening when they come back to home after their lunch was digested. Generally, my patients did not complain. If you heat probably if they are complaining of sticking in mouth, etc., probably they are not heating the oil. Generally, when you heat oil and put it, it will come smoothly. Agar fir bhi, if they are not ready, is last option. Either you can ask them not to do, or you can ask them हाथ में same dose लीजिए, and you can ask them to take it like apply it through their hand to the nasal mucosa. This is mentioned by Charaka only. Like in Swastha, this is what to be done, and in Rogi, you can instill drops.
Namaste, sir.
Thanks, sir.
Namaste.
Namaste. Sir, how about egg? About egg white or egg, the usage of this?
Yes. So basically, why egg is used is they tell protein gets absorbed through sheath, etc. So this is all like this is egg or what are you tell this flaxseed gel which is in trend these days. These target more of symptomatic. These don't address the root cause. For example, if your hair is dry, like too much of vata, and people who don't oil, their hair will be dry. For them, if you give such as flaxseed or egg, it will be softened. So it acts more of symptomatic than breaking the pathogenesis is what I felt and what I understood in my practice.
Okay. Flax seeds internally or externally? You mean,
Internally, I don't use because it is Ushna and it is Achakshusha. I generally don't advise flax seeds. I mean, I also did not get the need to use the flax seed, so hence I never recommend.
And application of aloe vera gel, sir?
Aloe vera it will use because it is again, if you say aloe vera, it is Tikshna, etc. It is Pichila. So if you apply it to your scalp and if you apply it to your hair shaft, it will work. It will work wonderfully. It will actually act on hair fall, unlike flax seeds, atasi or egg yolk. Those act symptomatically, whereas aloe vera will help in samprapti vikatana.
Okay, sir. Thank you, sir.
Thank you.
बहुत बहुत धन्यवाद डॉक्टर साहब. एक्स्ट्रा ऑर्डिनरी वंदे भारत वंदे भारत presentation.
Hello, sir. Sorry. Any seborrheic dermatitis treatment? Ayurvedic seborrheic dermatitis in head.
I think I had explained. I will explain again. So basically, what cases I saw, अग्निमान्य होता है उसमें. So mainly अग्निमान्य और रस समावस्था होता है when you should do Agni Pachana, Agni Deepana and Pachana with Agni Tundivati works very well. Agni Tundivati or Arogyavadinivati, depending upon their type of Agnimanya. As I have explained, any Bringaraja Churna you can take along with it little Tankana you can mix. For example, say you are using 10 to 15 grams of Bringaraja, you can add 0.5 to 1 gram of Tankana. आप देखिए बहुत ज़्यादा पित्त प्रकृति है तो since it's Tikshna and Ushna, it will irritate the scalp. You can add this. If it's dry scalp, you can add Dadi. If it's Ruksha, if it's Snigdha scalp, you can add Takra. So you can, as a Sanika Chikitsa, you can give that. And if you feel there is lot of seborrheic dermatitis, you can go for Kajra Arishta also. And if hair fall is there, you can go for a Trichup or Punanavadi Mandora also you can use, since it has Kushtahara as a Falashuddhi and properties also you can use. This should work. Nidana Parivajana as I told.
बहुत बहुत धन्यवाद. उज्ज्वला ने एक क्वेश्चन.
Flaxseed soak नहीं है अभी. Generally, even if you tell them to soak, they won't do. Generally, what is the trend is 1:4. For example, 1 part of flaxseeds, 4 parts of water. You can heat it to till it becomes a jelly consistency and use. But however, I avoid advising this to patients, because see, if you advise something which is already popular in Instagram or social media, no, I personally feel it's not up to the mark as a doctor, क्योंकि उनको ऐसे महसूस होता है कि ये तो YouTube में ही बोल रहा है, ये डॉक्टर को पैसे देना क्यों, we should listen the same thing. So even though it's simple, you advise something from Ayurveda. See, anyway, flaxseed only helps in symptomatically and not samprapti vikatana. If you want to do one thing, you ask them to advise it. For example, take Bringaraja Churna itself. Ask them to apply this Bringaraja Churna with flaxseed gel, in case if they're already following it. Then it would be like you also given a point to them, and what they're doing is also is correct, they feel. So mentally patient will be happy.
बहुत बहुत धन्यवाद डॉक्टर साहब. बहुत अच्छा.
Ringraj and Tankan for local application.
हाँ, scalp में. Seborrheic dermatitis you're talking about in the scalp, right, or in the face, or in any other part of body?
को दही में मिलाकर लगाना है, दही में।
हाँ, लगा सकते हैं। आपको अवस्था वाइज देख के अगर रुक्ष है तो दधी मिलाइए,
हाँ जी,
स्निग्ध है तो तक्रर दीजिए।
ठीक है, थैंक यू सर।
आप देखिए पित्त प्रकृति है तो मत कीजिए, ज्यादा पित्त दृष्टि है तो मत कीजिए। आप काशी से ट्राई कर सकते हैं, पित्त ज्यादा है तो।
क्या कर सकते हैं, सॉरी?
काशी से भस्म भी ट्राई कर सकते हैं, काशी से
काशीस भस्म दही में?
नहीं, इंस्टेड ऑफ टंकन भस्म यू कैन ट्राई फॉर काशी से भस्म आल्सो,
दही के अंदर, ठीक है।
हाँ, लेना नहीं है एक्सटर्नल एप्लीकेशन। सिर्फ काशी से और टंकना नहीं है, मिलाना है। जो भी भृंगराज है, जपा है, यष्टि मधु है, किसी के साथ मिला के लगाना है।
अच्छा, थैंक यू सर। काशी सादी भस्म।
Yes, with the karma I have learned online, and I had attended one offline training with Amol sir also. Yes, actually, if you ask me frankly, देखो अभी जो विद्या कर्म नाड़ी ही ले लेंगे, like for example नाड़ी ही, see even if you attend any nadi training sessions, it's not like they will simulate a particular type of nadi and they will make you to feel it. It does not happen like that. Or that, I mean, before in Gurukul style of teaching, it used to at least happen, like Guru used to be baju mein hoke, he used to teach. But abhi, even if you attend any type of nadi, that won't teach you like ye aise hai, ye aaya to ye hai. It is not like that. And what school of thought I have learned from Dr. Sanjay Kumar sir, he is a Maharashtra practitioner. So that type of नाड़ी is more of mathematical deduction. ऐसे थोड़ी ना है अभी नाड़ी बोले तो हमको क्या माइंड में रहता है, it will just speak for itself. No, nadi does not happen like that. It's like a tally table. It's like it's a table. It's not plus or minus. You should deduct it from the nadi. So see, feeling a nadi, it's like a river. For example, what I would feel in the same nadi, you may not feel, because you can't touch the same nadi twice. It's like a river. You can't touch the same river twice. No, you can't touch the same nadi twice. And hence, if you want, we'll do a nadi session also, but it will need 2 to 3 sessions at least. But before that, I'll tell you what school of thought I have learned in nadi. It will mainly indicate the pratama, the main disease in the body. But I don't know how to explain this, but if you're really interested in learning something, it will feel like that is speaking to you, be it with respect to Ayurveda or be it with respect to Nadi. It will start speaking to you, and at one point you will find your own way to identify other issues also. This, if Nadi comes up, we'll pakka take this. As I told, see, this is my take on Hairfall. You might be having a different opinion and you might be succeeding it. So you're not wrong, I am not wrong. Similar to Nadi, there is different school of thoughts. One might perceive in one way. As far as you're telling the patient, you're understanding it and you're treating it, it works for all of us.
बहुत बहुत धन्यवाद डॉक्टर साहब। एक्स्ट्रा ऑर्डिनरी अपना लेक्चर प्रेजेंटेशन, वंदे भारत, बहुत अच्छी स्पीच
Thank you.
और बहुत अच्छे शॉकर्स। कहीं भी इधर उधर पार्टिसिपेंट्स और मतलब ही नहीं है कि कहीं वो सरक जाए ध्यान। बहुत ही अच्छी प्रेजेंटेशन। और
नहीं सोया था।
जामनगर में गुलाब कौरबा आयुर्वेद महाविद्यालय, जो अभी तो यूजी इट्रा ITRA में मिक्स हो गया, एक हो गया, मगर हम जब पढ़ते थे तब थे तो हमारे टीचर्स ऐसा ही एक्सप्लेनेशन करते थे और सच में बहुत अच्छा लगता था कि अच्छा हमें भी कभी आएगा कि नहीं ऐसा करना। तो बहुत ही अच्छा लगा। और क्योंकि मैं स्वयं भी बहुत बार दोष के आंतरिक गुण, है ना, कि द्रव गुण बढ़ गया, सर बढ़ गया, है ना, तो ऐसा नहीं कर पाती हूँ। मैं चरक भगवान को कहती हूँ, मैंने कहा गुरुजी इतना आता है, मरीज ठीक कर दो। और सच में
बस
हो जाता है, सच में हो जाता
हर
है।
बार ओपीडी में भी नहीं होता है ना, इतना डिटेल हिस्ट्री लेने के लिए भी नहीं होता ओपीडी
नहीं, और इतना बेटा कर भी नहीं पाते, है ना।
हाँ,
मीन्स देयर आर वेरी कॉम्प्लेक्स सिम्टम्स ना, कि भाई ये भी हो रहा है, वो भी हो रहा है, पिछले वाले को तो ये नहीं हो रहा था। तो मुझे लगता है कि
True,
हाँ,
true,
आपने
true.
बहुत अच्छा पॉइंट बोला कि भाई कहीं ना कहीं हम एक बार संहिता खोले, संहिता को पढ़े, है ना। तो ये पॉइंट मुझे एक्स्ट्रा ऑर्डिनरी लगा है। और टेक टू होम मैसेज में पूरा लेक्चर तो है ही है, मगर साथ में मैं कहना चाहूंगी कि संहिता को खोलना चाहिए। और बल्कि
True, ma'am.
पिछले वाले उसमें भी कहीं ना कहीं हमारी डिस्कशन हो रही थी कि एमडी के प्रत्येक किसी भी विभाग में एमडी करो, चरक संहिता का पेपर फिर लगना चाहिए। कि चरक
पक्का लगना
संहिता लगेगी, चाहे किसी भी डिपार्टमेंट में एमडी करो। तो मुझे लगता है कि उसकी रियल डेप्थ कि चरक कितने महान थे, एक
True,
संप्रदाय
true.
था या एक व्यक्ति थे, कुछ नहीं पता हमें, कि एक्स्ट्रा ऑर्डिनरी व्यक्तित्व वाला वो संप्रदाय को हम उनकी दी गई बातों को हम समझ सके कि ओहो ये बताया है ना। क्योंकि
True,
हीरे
ma'am.
को परखने के लिए जौहरी तो बनना ही पड़ेगा, वरना आपको बिना जौहरी बने हीरे की परख कैसे कर पाएंगे। तो इसलिए मुझे लगता है कि सही में संहिता को खोलना चाहिए, और उसमें पड़ी हुई हर बात कहीं ना कहीं काम में आती है। ऐसा मैंने, आज मैं 55 साल की हो गई तो भी मैंने ऐसा महसूस किया कि कभी कभी क्या
हाँ,
होता
thank
है
you.
ना, तो 2 दिन बाद वही मरीज आता है, तो फिर चरक ने कुछ प्लान कर रखा था कि बेटा पढ़ ले, कोई आने वाला है। तो
True.
एक, हाँ, कुछ अनुभूति ऐसी भी हुई ऐसे कि भाई तुरंत ही, और कभी ढूंढने के लिए भी चरक पड़ा तो भी तुरंत मिल गया, है ना। वरना ऐसे
Hmm.
सोचते थे कि 120 चैप्टर कैसे पढ़ेंगे, मगर वो भगवान ने 120 चैप्टर नहीं, 119 चैप्टर के सिवाय एक चैप्टर पढ़ते हुए ही वो करवा दिया। तो सही में ये बहुत सही बात है कि हमें संहिता को पढ़ना है, खोलना है, और उसमें एक आप्त भाव रखना है ना। यादृशी
True, true.
भावनयस्य सिद्धिर्भवति तादृशी। जैसे आप भावना के साथ उसमें इंट्रोड्यूस करते हैं, एंटर करते हैं, तो मुझे लगता है कि कहीं ना कहीं वो उसको फुलफिल करता है। डॉक्टर उज्ज्वला, लास्ट क्वेश्चन।
हाँ.
जी
मैम क्वेश्चन नहीं है।
जी जी
जो अभी लास्ट वीक है ना, जमदग्नि सर का एक सेशन हुआ था, सर का होते ही रहता है ऑनलाइन, वो पढ़ाते रहते हैं स्टूडेंट्स को। तो उसमें सर ने बोला था कि बार बार पैरासिटामोल जो लेते हैं ना, तो वहां पे क्या होता है कि रसगत आम वैसे ही रह जाता है। फिर वो रसगत आम है ना, तो पैरासिटामोल लेने से रहने से फिर पूरी जो रस धातु दुष्टि तक, शुक्र धातु तक दुष्टि हो जाती है। तो वहां पे
Yes.
हमें देखना है कि, तो वहां पे ज्वर की चिकित्सा करके सर ने बोला था कि उसकी वजह से क्या व्याधि निर्मित हुई है। हेतु देखिए कि ज्वर निर्मित और पेशेंट बार बार पैरासिटामोल ले रहा है, तो वहां पे हमें उसके हिसाब से जो लक्षण है उसका चिकित्सा करना है। ये सर ने पॉइंट बहुत अच्छे से बोला था लास्ट वीक के लेक्चर में, जो पीसीओडी का शुरू है सर का अभी सेशन, तो उसमें बोला था। तो ये मुझे बोलना था
That
मैम।
is true.
और यष्टि मधु के बारे में कि जैसे जहाँ पे विकृत कफ निर्मित है ना, तो हमारी जहाँ पे विकृत कफ निर्मित है, तो हमें ऑटो इम्यून डिसीज होते हैं, और प्राकृतस्तु बलम श्लेष्मा, तो वहाँ पे हमारी इम्यूनिटी अच्छी बनती है। तो जहाँ पे हमें पाचन के बाद जहाँ पे इम्यूनिटी अच्छी बनानी है, वहाँ पे हम केश द्रव्य जो कि बलवर्धक है, तो यष्टि मधु के हिसाब से वही हम दे सकते हैं, कि जैसे कि अस्थि धातु का, या फिर हमारा पूरा कफ, अच्छा कफ प्राकृत बनाने के लिए यष्टि मधु हेल्प करेगी। ये मैंने प्रैक्टिस में विचार किया था सर, तो मुझे बोलना था। धन्यवाद।
Nice.
जी डॉक्टर उज्ज्वला, बहुत बहुत धन्यवाद। और सबसे
सॉरी डॉक्टर, इसका रिकॉर्डिंग मिल जाएगा कहीं? मैंने लेट ज्वाइन किया, सॉरी।
हाँ जी, हाँ जी, मिल जाएगा। आप किसी, जहाँ से आपको लिंक मिला ना,
हाँ जी।
उसी मैसेज में सबसे नीचे यूट्यूब चैनल का भी लिंक है।
ओके।
तो हाँ जी, हाँ जी, और मैं फेसबुक के ऊपर भी यूट्यूब चैनल का लिंक डालती हूँ, है ना। तो आप वहां से भी ले सकते हैं। और प्रीवियस भी बहुत सारे एक्स्ट्रा ऑर्डिनरी लेक्चर्स है, उनमें से भी किसी न किसी को आप सुनते रहेंगे, तो उन स्पीकर्स ने जो समर्पित भाव से अपना समय और ज्ञान, है ना,
हाँ जी।
जिसकी भरपाई नहीं हो सकती, हम कुछ नहीं देते किसी भी स्पीकर को, मगर बहुत अच्छा ज्ञान अवगाहन हो जाता है, तो वो भी आप वहां से सुन सकते हैं।
Okay, madam, I am 71 year old from Tivia College, but still
Oh, nice.
I read every day, every day. यूट्यूब, ये सब मेरे को इंटरेस्ट है। तो मैं इसलिए पूछ रही थी, मैंने लेट ज्वाइन किया तो मेरे को रिकॉर्डिंग मिल सकती है। आई एम वेरी मच इंटरेस्टेड।
बिल्कुल बिल्कुल ओके, मैं अपना नंबर डाल दूंगी, आप उसको एक बार जब वीडियो करते हैं आप लोग लीजिए।
हाँ जी, हाँ जी। फर्स्ट बैच ऑफ BMS दिल्ली यूनिवर्सिटी,
अच्छा,
बट स्टिल आई एम वेरी मच इंटरेस्टेड।
That's very great, ma'am.
बहुत ही अच्छा लगा। हम सब में सबसे ज्यादा सीनियर आप है और
हाँ,
इस ज्ञान पिपासा को वंदन है। और
नहीं,
भगवान करे आने वाली पीढ़ी आप जैसी ज्ञान पिपासा लेकर आए और भारत में आयुर्वेद को प्रचार प्रसार करने में अपना संपूर्ण योगदान दे।
मैडम मैं तो पंचकर्म सीखने के लिए इतनी इंटरेस्टेड हूँ क्योंकि हमारे टाइम में इतना सेटअप नहीं था पंचकर्म का तिबिया कॉलेज में।
जी
तो
जी
मेरे को कोई चांस नहीं मिल रहा। मैं दिल्ली में रहती हूँ, मालवीय नगर। मुझे कोई ऐसा है स्कोप तो मैं आई कैन
जी, ये
पंचकर्म,
खूब अच्छा
आई
है।
वांट टू।
हाँ जी, आप
आपका नंबर आपने भेजा है मुझे?
नहीं आप अगर आप मुझे नोट कर लीजिए।
आप मेरा नंबर प्लीज नोट कर लीजिए, मुझे चेक करना आएगा नहीं आएगा।
अच्छा अच्छा अच्छा, ठीक है, लिखिए नोट कीजिए।
999958
जी, 9958
335548।
335548। फिर
हाँ,
बोलिए।
99
हाँ,
9958335548।
ओके डॉक्टर साहब, ओके ओके, विजय जी बहुत अच्छा।
हाँ जी, आप मेरे को नंबर अपना भेज दीजिए प्लीज।
जी जी, मैं कांटेक्ट करूँगी।
हाँ, मुझे कहीं भी कोई प्रॉब्लम आएगी तो आई कैन कांटेक्ट यू।
जी जी, बल्कि हमारे कांटेक्ट आपके एक्सपीरियंस से जो आपका कांटेक्ट हम
एक्चुअली
रखेंगे अपनी ही उसके लिए, क्योंकि आपने
मैं
बहुत
आपसे
अच्छा
रिक्वेस्ट करूंगी
ज्ञान
क्योंकि
दिया।
मेरे सन इन लॉ को थायराइड है और वो डॉक्टर हैं खुद, पर वो मेडिसिन खा खा के हार्मोनल परेशान हो चुके हैं और मैं चाहती हूँ कि उनको कोई थायराइड का स्पेशलिस्ट मुझे बताइए। मैं उनसे अपॉइंटमेंट लूँ और उनको ठीक करूँ।
जी डॉक्टर साहब, अभी बात करते हैं।
हाँ, ही सेल्फ इज अ पल्मोनरी चेस्ट। हाँ, वो थायराइड की मेडिसिन खाई जा रहे हैं। मुझे बहुत अफसोस होता है कि थायराइड साइड इफेक्ट तो आएंगे ना।
बिल्कुल बिल्कुल आएंगे साथ में। मैं
हाँ,
आपका एक बार धन्यवाद करती हूँ विस्तार और डॉक्टर तेजा जी, आपका बहुत बहुत धन्यवाद कि एक इमरजेंसी लेक्चर भी तैयार रखिएगा, कभी कभी बिजली गिरती है तो
पक्का आप जब बोले मैं तब रेडी हूँ।
जी जी जी। तो कई बार क्या बहुत सारे लोग हैं मगर जो शाम की लगभग प्रैक्टिस है, अभी डॉक्टर आलोक मेरे क्लासमेट भी रहे, तो उन्होंने 1 घंटे की प्रैक्टिस छोड़ी, कहते अच्छा तुम 10 साल से चला रही हो, मैं 1 घंटा तो दे ही सकता हूँ। तो आज ही कुछ इमरजेंसी हो गई थी और मैं सभी पार्टिसिपेंट को भी कहना चाहूंगी कि डॉक्टर तेजा जी ने ये वाला लेक्चर आज के दिन का भी इमरजेंसी में ही दिया है। किसी और स्पीकर ने कुछ व्यस्तता रहते हुए मना किया और बहुत ही टाइमली मना किया, है ना, क्योंकि कई बार ऐसा भी हो जाता है कि स्पीकर जी को भी कुछ नहीं पता होता है कि उस दिन कुछ होने वाला है, तो काफी इमरजेंसी हो जाती है। मगर आज का आपने इमरजेंसी के रूप में भी तुरंत अपनी सहमति दी और आज का लेक्चर आपने डिलीवर किया। बहुत बहुत हार्दिक धन्यवाद।
थैंक यू सो मच
डॉक्टर
मैम।
डॉक्टर तेजा, गॉड ब्लेस यू।
थैंक यू सो मच मैम। थैंक यू विजय
हेतल जी, आप भी धन्यवाद के पात्र हैं। ऐसी सब विषम परिस्थिति में भी आप कंटिन्यू रखे हुए हैं, आप भी साधुवाद की पात्र हैं।
जी
नहीं,
शुभ कामनाओं के लिए बहुत बहुत धन्यवाद।
थैंक यू, वेरी नॉलेजेबल।
लास्ट में मैं शांति मंत्र ले रही हूँ, आप सभी अपना बैठकर भी दोहराए।
वन
ओके।
ओम
सेकेंड वन।
सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामया, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखभाग् भवेत्। ओम शांति शांति शांति। नमो नमः। विश्व मंगल की कामना के साथ हम सभी आयुर्वेदज्ञ अपने अपने भाग का प्रतिनिधित्व और योगदान करते रहे। बहुत बहुत धन्यवाद।
वंस अगेन डॉक्टर हेतल जी, व्हाट आप जो काम कर रहे हैं ना, ये सब दैट इज वेरी, आई नो द एफर्ट बिहाइंड इट, आप बहुत अच्छा काम कर रहे हैं कि आयुर्वेदा का नॉलेज स्प्रेड करने में. आई रियली एडमायर यू फॉर दैट. एंड शायद पार्टिसिपेंट्स को पता नहीं है वो कितना मुश्किल है, बट यू आर रियली बेनिफिटिंग द आयुर्वेदा फ्रेटर्निटी. आई रियली कंग्रेचुलेट यू एंड थैंक यू ऑन दैट पॉइंट.